David, we will be,
Well, he didn't like it when.
Jeremy, are we ready?
That's all right.
Are we set? Okay. How's everybody doing? I'm going to call the meeting of Milton Plan Commission for Tuesday, April 10th, 2018 to order. The first item on the agenda is the roll call.
Commissioner Paulson.
Here.
Hubbard.
Here.
Barr.
Here.
Zellers. Present. Olson.
Here.
Here.
6 present. Dorn is absent.
Okay. Well, the next item on the agenda is the approval of the minutes.
Move approval. Second.
So the motion is approve the minutes for March 27th. All those in favor say aye.
Aye.
Anyone opposed? So the motion for the minutes passes. So could we take number 8? We have 5 more minutes, so.
Yeah, we can.
Okay, so we're gonna go to number 8, which is the concept review for future form transformer location.
And they
So,
do have to lose 1 or 2 street trees. They would have to remove them. So Mark Wagner, the city forester, is asking that we refer to park recreation forest. So it could potentially, I would think it could be approved, conditioned
Conditional.
upon their,
could you speak in the microphone?
could be approved conditioned upon their approval and
I'll-
subject to their.
I'll move approval condition on.
Second.
Okay, the discussion, are those guys here? Anybody you want to say more about it?
I'm not sure if Future Foam is here.
Is anybody from Future Form here?
Oh, sorry. This is on Future Foam. It's a transformer change. They're moving their transformer to have more room for maneuvering on their site, and they're going to lose 2 street trees in the process. So it's been referred to PRFC, Park and Recreation and Forestry, but approved subject to that. Or it's, at least that's the motion so far,
And you recommend approval subject to
subject to staff.
staff comment?
Yeah.
Anybody from Future Form? It doesn't look like it. So I have seen, I think these 2 changes actually will improve that facility, and they really do look ugly. So I think that's a good thing, so.
Transform.
And so the motion is, this is the item number 8. This is the approval of the concept review and referring to the Parks Commission. And all those in favor say aye.
Aye.
Anyone opposed? So the motion passes. It is 7:05.
Sign-up sheets if they.
Well, if you want to speak, there are sign-up sheets there, and there's a Mark Opitz there. He's handling those sheets, and we are going to open the public hearing in 30 seconds.
And you can also sign up to register either without speaking either in support or against a project that's having a public hearing tonight. And there's 3 public hearings.
What is your time?
Whoops. 7:04 by mine, and
Okay. Do you want to take any other item here?
I don't think we have anything else that's, well, we have Stagecoach, but that person might not be coming for a while.
Well, we got to wait about a minute, so.
7:05 on my phone.
Excellent.
Okay. So it's 7:05. I'm going to open the public hearing. The request for general implementation plan, GIP amendment, Airport Road Business Park, lots 2 and 3, CSM 13300, Miramart, Formal Strategic Behavioral Health, 3169 Deming Way, add hospital as a conditional use permit, and Abby is going to start.
Yep. One of the Plan Commission members asked that staff just quickly go over what the 2 hearings are about, along with what exactly a conditional use permit is and what will be reviewed tonight. So the 7:05 p.m. public hearing is related to a request for a GIP amendment. GIP stands for General Implementation Plan, to add hospital as a conditional use, specifically to this property that's outlined in red here. So it's 1 and we'll say almost a half lots in the Airport Road Business Park. The Airport Road Business Park is bordered on the north by Airport Road, on the west by the Creek Corridor, and the south by the Confluence Pond, the east by the Beltline. So this entire property is zoned Planned Development District, which is a special set of zoning regulations that pertain to this part of the city. At 7:10 p.m., there's a hearing for a request for a conditional use permit to operate the hospital. So, they're clearly related to the same project. If you're interested in speaking about this topic, you can speak on either one of the two public hearings. You can speak on both if you'd prefer to do that. A conditional use permit allows the city to consider uses which may be essential or desirable, but which are not allowed as a matter of right, within a zoning district through a public hearing process. A conditional use permit can provide flexibility within a zoning ordinance. So within each zoning classification and within each PDD in the city, there are permitted uses and there are conditional uses. In the Airport Road Business Park Plan Development District, or PDD, the permitted uses are sales, manufacturing, fabricating, processing, research, and office uses which are permitted in the industrial zoning district, and nursery. The conditional uses within the Airport Road PDD are agricultural, horticultural, recreational facilities, retail sales and service operations which are ancillary to the permitted industrial use, warehousing, wholesale sales, research, and office operations. These may include restaurants, office supply businesses, and daycare centers. So many of the uses within the Airport Road Business Park are conditional uses, and they've gone through the conditional use approval process. The zoning ordinance gives us guidance on how to review conditional uses. And it says that applications to establish or modify such uses shall be decided as a matter of discretionary judgment upon consideration of the specific proposal in relation to the site, uses of neighboring properties, area conditions, and the provisions of the city comprehensive plan. The zoning document actually says master plan. We call it a comprehensive plan now. Within the city's adopted comprehensive plan, which we're actually in the process of updating currently, the plan states, as Middleton and its neighboring communities continue to grow, the construction of new or expanded healthcare facilities is anticipated. And there's a goal within the comp plan that says to strive to provide Middleton's residents with access to education, health, and recreation services, and opportunities to help promote active lifestyles and physical and mental health. We put together a map based on an article that ran in the State Journal in February, outlining some of the other locations in the county that have psychiatric care. So you can see, there's a facility at the UW Hospital. There's a facility at St. Mary's. There is a facility off of Northport Drive, and not sure what that one on the southwest is, actually. I bet Mark knows. You put the map together. So for a conditional use, if the Plan Commission decides to make a motion to approve a conditional use, that can be done and shall include identifications of any conditions that the approval is contingent on. So the zoning code gives us guidance on what those conditions can address, and it specifically mentions that the conditions may address the site plan, timetable of development, operation of the activities, or other considerations relevant to applicable standards. So when reviewing this conditional use permit application, The Plan Commission should use some of the same considerations that have been given to other conditional use permit applications. Zoning, the purview of the Plan Commission is to review the application per the city's zoning standards. And zoning is about how this land use will interact with its surroundings. Zoning is not about regulating the way that a healthcare facility deals with patients. The commission's role here is to look at this from a land use standpoint. Our expertise is not in healthcare facilities. It's looking at this purely from a land use standpoint. Hospitals are a regulated industry, and as with any other regulated industry, any approval from the city would assume compliance with all applicable laws and regulations. So when the city takes action to approve a project like a restaurant, we assume that they are going to comply with all laws. It's not typically stated in any approval that's given by the city, but it's assumed. From a staff perspective, looking at this from a land use perspective, we feel that the project fits into the Airport Road Business Park, and we looked at that, as it pertains to the scale of the building, the height of the building, the setbacks, lot coverage, landscaping, and parking. So our staff recommendation is to hold the public hearing, listen to the comments, and if the Plan Commission decides to take action, we would recommend one condition of approval be that the applicant would submit a security plan, which would be reviewed by the police department and approved by the police department, and that that would be tied to the conditional use permit. So that means that if the city moves forward with the project and the applicant decides to change anything regarding the security plan, that would go through the PD for approval, and that would be tied to the conditional use permit. I know that the applicant was wanting to make a presentation as well, which I'll pull up here.
So you're done?
Yes.
Okay, so I'm going to ask Mike or... Okay, can you hear me now? Okay, so you want to make a presentation, but more specifically, you have seen this article in Wisconsin State Journal. So I would really like that if you address those concerns as they stand now.
Sure.
And along with, what you present about the
Right.
facility. Thank you.
Okay. Appreciate it. My name is Mike Garone. I'm the Director of Development for Strategic Behavioral Health. This presentation was one that was delivered once before at this Planning Commission and at City Council last Tuesday. So we're going to move through it really, really quick and allow for an opportunity to answer questions and then, of course, talk about some of the information that was in the article. So you know who we are as a company. We're a company that is based in Memphis. We own and operate psychiatric hospitals throughout the country. We currently have 10 facilities operating in 6 different states. This would be our second project in the state of Wisconsin. We have a facility in Green Bay that's currently operational. How we decided to come to this community is through a series of very in-depth market research that took into consideration several different metrics that are important to our business and project feasibility. Those include the availability of resources, the types of resources that are available, the ability to retain and recruit staff, the sophistication of the outpatient environment, the cost to build, cost to operate, all these different metrics. Did this research for over 100 markets. Dane County came in very high on our ranking, which then meets the criteria for me to come in and start to meet with stakeholders in the community, which occurred, and they confirmed that the data, in fact, did support feasibility for a project. The project details, we're talking about a 72-bed freestanding psychiatric hospital, approximately 54,000 square feet. The building sits on 7 acres. It was described and shown through the aerial a moment ago. We would treat all different patients from different ages. We would have separate and dedicated units for children, adolescents, adults, and seniors, and we would also offer services for those that are chemically dependent. In addition to inpatient services, we'd offer outpatient services in the form of partial hospitalization and intensive outpatient. Several different community benefits. I don't want to spend too much of our time talking about this, but really we're talking about access to care. And for those individuals and families that are dealing with and responding to mental health crisis, they need to have availability within this market, and that's what we're proposing to do. Pretty significant economic impact. We went into this in great detail last week at the City Council meeting. We are proposing to have a capital investment between $17 and $20 million. Have a pretty significant annual salary of, I believe it was 11 million when you count benefits. We would also have an impact on those related costs for transportation of individuals out of the community to receive care. Several stakeholders from the community that we met with, we don't just go off of data, we talk with individuals who have their finger on the pulse of how patients are accessing care, where the service gaps are, and this is a list of individuals that, agencies or individuals that we met with that were in support of the project. This shows our service area. So as you can see, although we would be located in Dane County, we would be a regional service provider, so we have a secondary and a primary service area. Really quick, our data, we base our information off of a widely adopted psychiatric bed need formula, and you can see here, based on your population and the existing availability of beds, there's a significant need in your community. I won't go through that. So we talked a little bit about out-migration. So you can see here, this was information provided to us by the Sheriff's Department, which took into consideration several different jurisdictions. Talks about the tremendous burden on your law enforcement to try to transport individuals who are on a legal commitment out of this community up to receive care at Winnebago Mental Health Institute, which is the closest receiving facility for the patients in which they're responsible for transporting.
My name is Jim Shaheen. I'm the president and founder of Strategic Behavioral Health. I think we're going to go through a few pictures of the facility, which you've seen, but I would like to address the article directly. A couple of things. Certainly, we have never professed to be perfect in what we do, but we're very good at what we do. Last year, we treated 30,000 patients. And so in that time period of treating 30,000 patients, facilities from time to time have had issues with the particular patients or even a staff member from time to time. I have over 3,000 employees across the country. And so we certainly haven't had any issues within the facility that were not absolutely corrected. In fact, part of the process in a highly regulated healthcare, part of the process is the regulators come in and they find where you need to improve, and they decide the speed at which you need to improve. And in the last 12 years, we have never not improved and never not satisfied the regulatory agencies. We have never lost a license. We have never lost a Medicare certification, and have been able to show, in fact, when an issue occurs or when a staff doesn't do the right thing by patients. We know how to handle that. We know how to retrain. We know how to fix those matters. With a healthcare entity, I don't know a healthcare entity that doesn't get regulators in their building asking them to improve and do things in a better way. Specifically to some of the concerns around, for example, a facility in Charlotte that had kids elope from the facility for an hour. That building, unfortunately, is not one of my buildings. I bought that program. We do not have the elopement issues with the buildings that I build. Secondly, those issues that have occurred in a couple of facilities have all been long-term residential kids. The states, most of the states have asked us to provide care for the long-term residential. We're not doing that in several states, and do not have a plan to ever do that here in Wisconsin, not in Green Bay or not here. Our program is designed specifically for patients in crisis. I think one of the things that we find a lot is patients in crisis, they get aggressive sometimes, and we are charged with keeping them safe. And that's what my staff are trained to do. Again, I've got over 3,000 employees across the country. Doesn't mean I don't have employees from time to time that do dumb things. I'm not going to stand up here and say that doesn't occur. But I can tell you that what we've been able to do and show regulators is that we are able to absolutely identify, and in most cases, interestingly, of any of those sightings we've gotten, we identified the issue already. But the way regulations work is they come in backwards and go backwards and look at issues and cite you, but immediately when you show them you've already corrected those items, done the retrainings and whatnot, then they acknowledge that, and then they come back and they reverse the findings. It's happened every time. Not once have we not been able to do that. And I think, from a concern standpoint from folks, certainly we're willing to have the police approve a security plan. Our buildings are very secure that we build. And are able to manage the patient populations that we agree to manage. Again, our model here is very simple. It's to treat acute people in acute crisis that we find that need help immediately. Again, I'm not in the habit of calling out the press, but everything you read is not accurate. And so I think it's important to note that we are a solid company. Some of the articles and things that I've heard is this kind of for-profit. I hate to tell you that every physician you go to see has to pay his own bills, has to eat. And so this notion that a for-profit hospital can't provide care like a not-for-profit hospital is really makes no sense whatsoever. And the other part of the article that addressed the hospital that was here 30 years ago that closed, this was 30 years ago, and we closed over 800 psychiatric hospitals during that time period across the country. This wasn't a Dane County issue or a need issue. It was a change in the business model that caused those 800 hospitals to close during that time period. And so we understand our business model. We know we've been very successful in our 10 hospitals. And in doing all of that, built in that business model, and this is where folks don't understand, is to take all payers or even non-payers. My hospitals do that. Now, the article addresses some staff members, former staff members, terminated former staff members, take that for what it's worth, saying we don't take all of the patients. Yet, your own police department have talked with the police department in Green Bay, as an example, and gotten a resounding absolutely they take everyone. And so, I'm very proud to be able to say that in all of my hospitals and be able to show that. I'm not standing before you saying, hey, just believe me. I have an operation in this state that's doing it, and you all have vetted that as well. So Again, some of the things you hear in the articles aren't, necessarily accurate, but I'm happy to answer any questions. I'm happy to speak to anything. One of the things that I have said since the minute we stepped into this community is that we are an open book. We don't hide anything. We will answer any questions and are able to do so.
Jim, I will start. So to begin with, you said that in most cases, you had already identified the problem and you had taken care of it. And the inspection people came and they just noticed it. And how many of these out of 9 violations you already knew, and it was an afterthought on the
Right.
for the inspection agency?
There's not 9.
Okay.
Let's be very clear about that.
Okay, 4 or 5, whatever the number.
Well, I think it's an important distinction.
Okay.
The way Joint Commission works and the way CMS works is they come in and do a survey, and they survey, as you can imagine, everything possible within a hospital. And sometimes they reach a level of immediate jeopardy because there are 4 or 5 different areas added together create that. Not in and of themselves, they may not be an issue at all of immediate jeopardy, but if you have several, this is the way Joint Commission does it, it's the way it's done in healthcare. So this idea that we had more than we did is sort of frustrating to me. However, I will say, of the 5 we had, 4 were self-report. We self-reported to the state, here's what happened, here's what we're doing about it. But the way regulations go, regulators have to still come in and they have to still cite you for even past things that they're investigating. That's the way it works. And so we have, one of the reasons we've been able to turn it around so quickly each time is because we'd already started when the surveyors come in. That they can't not cite you for actual events that occur. So that's, sure.
Okay, well, I have more questions, but let's.
This is a
Paul, go
follow-up
ahead.
to that. One of the things the article did not make clear is what is the rate of citation of similar facilities owned by different companies in those service areas?
Well, it's, let me say it
Because
this
people
way.
see the citation, they think that's a problem, but your rate of citation may be higher or lower than other similar companies.
Well, that's hard to address whether it's higher or lower. I can say, I've worked in this business for 30 years, and we have no more issues than any companies that I've worked for the last 30 years before I started this company 12 years ago. Again, I mean, your own systems here in town are all regulated by healthcare. We all have to answer to that regulator, and every state is different. And the article even says that every state sort of deals with this different. And I think the expert in the article told you there are, it's fraught with issues simply because of the way it's done. And so, but I know that doesn't fully answer your question. It's because I haven't pulled the public records of 800 psychiatric hospitals around the country. I haven't pulled those regularly, so.
If I could just add a couple of words.
Go ahead.
One of the things that,
Could you go to the mic?
I'm sorry. It's challenging for me, and I'm trying very hard to not take all of this personal, because I have the opportunity to go and to spend time at our facilities. And I have the opportunity to walk in and see what's going on and talk to families and hear about the care that's being provided and witness with my own 2 eyes the aftercare programs, people coming back into the hospital. And I think it's important to recognize when you're talking about 30,000 contacts in a year in a setting where many of the people that come into our care do not want to be there. They're on an involuntary commitment. And as a result of being on an involuntary commitment, satisfaction scores are going to be impacted. We work in an environment that is incredibly highly regulated, as it should be. But you have to understand the scale and the sample. Okay, no one's talking about the thousands and thousands of families that are better off today because of the care that we've delivered. And that's important to say. That is important to say because it's what gets us out of bed in the morning. And, you know, I'll just kind of back down a little bit, but I just feel like it's passionate for me to say that to you.
So, Mike, when you said 30,000, that's all the facilities, right?
Yes, yes, 30,000. And I guess there's one other thing I want to address, and that is, one of the concerns was that we were close to a daycare. Well, let me show you a slide. You have currently,
So there's
There-
five
is it-
facilities.
5 facilities, and within 50 feet to 100 yards to, that's the number of daycares that are around your current psychiatric facilities. Okay? So this concept that being next to a daycare as a psychiatric facility is a problem, well, you got a big problem if you think that that's an issue. So I think it's important to put that in perspective, that it isn't dangerous for a psychiatric facility to be next to a daycare, as evidenced by your own community and what that means. I'm happy to answer
Other
any-
questions from the commission for Mike or Jim? Okay, so now you have experience of 12 years, you have run 10 facilities, and you're going to have 3 more coming in this year and next year. So the question to you is that how are you going to apply the lessons which you have learned from other facilities to Middleton? That's the first one.
Well, I think we change and improve our training every day, because patients and sometimes staff show you every day a different behavior or something that you need to go and retrain and make sure. That is a constant for us in terms of doing that. In terms of having opened, we've opened 9 facilities from scratch, and I have a team of 10 subject matter experts, which are basically department heads, every department you can imagine in a hospital. I have a group of 10, 20-plus year professionals in each of those areas that come and they live in this community for about 6 or 7 months, 3 or 4 months before we open, to hire and train and teach. We start taking patients together, they stay. We go through Joint Commission and CMS certification, and they're here usually about 6 months. They live in the community to help train and teach. That's a group of 10 folks that are subject matter experts, and they've opened my last 3 hospitals for me. And we have come away with those last 3 hospitals with 0 conditional findings for Joint Commission and CMS in the last 3 openings. So we are applying what we learn every day and improving, and you can always improve. You should never say to yourself you can't improve, and so we're committed to continuing that.
So it is improving with each new facility. From what-
Absolutely. Like I said, the last 3, we had no findings for our surveys, no conditional findings.
So one of the big concern has been understaffing. You think you will be through the article and all?
Let me address that, because it's just completely false, and let me tell you why. We track every day. I track it in Memphis, and every day we track the number of employees that worked and the number of employees that were supposed to work. We track it every day. In Wisconsin, you have mandated staffing ratios that you have to meet. Period. End of story.
Okay.
And we have met those and continue to meet those. Because I got a couple of former employees that have a grudge and, speak to a reporter, it's absolutely not true. Staffing is a big deal, and we have staff turnover for sure. It's a tough population. It's a tough job to take care of people who, as Mike said, are there involuntarily, but have to be kept safe.
So I can see there's an economy of scale. So you have 10 facilities and you propose to open 3 more, right? 2 which are in the process, 1 in Iowa and 1 elsewhere in Tennessee, and the third one here. So that's almost a 30% increase. So do you have the capability to handle 30% increase in your facilities?
We do, but we're spacing those out already. So let me give you an example. My Kingsport, Tennessee, my next build will open in October. This building, if we're lucky, based on permitting and all of that, and that doesn't have to do with your local jurisdiction, but the state and all of that, it'd be a year before we even took our first patient there, here. And then Iowa is even further out because of the way the winter is falling. It's going to be at least 6 to 7 months past that. So we stretch ours out to be sure that we're not biting off more than we can chew in terms of that.
So you did try to address this concern or cherry picking, and would there be any reporting structure to make sure that doesn't happen? I mean, is there anything, to make sure that, that isn't happening? Is there some mechanism in place or something? I mean, that has been voiced by, various people.
Sure,
So-
sure. And so, yeah, there's certainly my financial audits. I'm audited every year. Each of my hospitals are. In fact, some of those become public when I file for certificates of need in certain states. And so, yeah, we track that every day. We track the amount of uncompensated care that we provide as a company, and it's a huge number. We don't. Again, I obviously can't do a building full of uncompensated care. Neither can do your med-surg hospitals here. In fact, your med-surg hospitals here are running a pretty low percentage of self-pay. And so we know that we can have an impact because patients come to us, and you have to understand the rules and regs around healthcare. If a patient comes to me, I cannot turn them away for their ability to pay. It's against the rules. You can't do it. So, I'm really not sure where some of that comes from, other than folks that maybe just don't understand and would like to just stand up and say for-profit is bad.
So the next one, Kurt Paulson already asked you that question, but there has to be some database to show that, there are comparable facilities and about your competitors, that what is their rate of violation? Is there if you already have it, if you could provide it to us, that will be great. Otherwise, it will be a lot of work for us to find it. So since there are competitors, I'm sure you are keeping track of them, what's happening there with
You
them.
do not. Not as a normal course of business. I've never pulled other hospitals' surveys and looked at them. From time to time in a given state somewhere, but I certainly haven't gone out and done that. And one of the reasons why is because I'm in this business every day. I understand that things happen from time to time. Where you get a concern is if you had lost your license, lost your CMS certification. The system is designed to identify where you can improve, and you improve. If you don't improve, guess what? They take your license, they take your CMS number, and that's just the way that works. And so it just hasn't been something that we've done. There's no national study. There's no. You literally have to pull 800 hospitals. It's just not something we do in our business.
I
So-
could just add real quick too. I want to kind of go back to what Abby was saying when she first started talking about the regulation. And we have Department of Health and Human Services and the Department of Licensure. There are accountability organizations, right? They're the ones who come in and they do, and CMS too, if they get involved. But they are setting the standard with which these facilities operate. They come in periodically or to respond to a complaint. They do their audit, their analysis. They discuss it with us. They sit down. If we put a corrective action plan in place, that gets reviewed and approved. They check us to make sure that we're following through with any corrective action plans. And if it's sufficient for them, then it's either found to be expunged or they take the license away. Right now, we haven't lost a single bed. And it doesn't reflect our care. I think there's going to be a lot of people who are going to stand up here and say, look at this, look what this company has had all these demerits and all these sightings. Everybody has sightings. If you Google right now one of the major health systems, any of the major health systems in this town or anywhere across the country, you're going to find a lot of different things. You're going to find wrong site surgeries. You're going to find a lot of different things.
Yeah.
That doesn't mean that they don't deliver good care. It just means that an incident happened through a high volume of care, and it was called out, they responded to it, and they continue to provide good care. And I keep coming back to this because I know what we do, and I believe in what we do. And it's hard not to defend what we do because I see it every day. And just because a couple of articles came out that point out some things that didn't go the way that they were supposed to, that doesn't mean that we won't have a considerable positive impact on this community.
Could you address one more question about the Aurora Medical? I mean, it just,
The what? I'm sorry.
you had a relationship with Aurora Medical Association. Yeah.
So here's the article that interestingly headlines it and says they, in the midst of staff turnover or whatever, they canceled the contract. Here's a letter from the CEO of Aurora talking about what a great partner we've been. They made a business decision because they had patients. They were sending their general practitioners over to do our history and physicals. They had too many patients in their own clinics. And so they came to us and said, we need to take care of our own patients in the clinic. We can't help you anymore. So guess what we did? We went out and got other internal medicine and nurse practitioners. The history and physicals are all being done, but the article doesn't like to say it that way because it's not salacious.
Okay,
It's worth
thank
reading
you.
the letter.
Any other questions from the Plan Commission members? David?
Of all the criticisms in the article, are there any that you would agree are correct?
Oh, certainly, we've had sightings. I have not said that we haven't had sightings at all. That certainly is true. The huge medical staff turnover in Green Bay, not true. We have locum tenens up there, which automatically, it's part of a recruiting strategy we have, because you take locum tenens and then you convert them into full-time doctors. That's part of how you get them to a community. So to say there's a bunch of medical staff turnover is not depicting the picture correctly. Have we, as a company, have we had from time to time a hospital or an employee that does a really dumb thing? Absolutely. Absolutely we have. But again, we've been able to fix that. We've been able to train on that, and we've been able to improve that. The article is fairly long, so I'm having a hard time, if that's okay.
Yes, David?
One other thing then, please. What relationship do you have to have, if any, to a major medical facility? Because I noticed in one of the things you put up, you talked about a potential UW link.
Yeah, we've certainly had discussions with them. It is a natural relationship in that part of why we're coming is because their beds are full. And so yet those patients are still going to their emergency rooms and are still in the community. And so we have to work with them in order for them to partner with us in order for them to refer to us. Anytime we have a major medical issue in our hospital, we send them to the emergency rooms. And so we partner with those entities to set up protocols with which we will be referring patients back and forth, working with one another. In some cases, like up in Green Bay, those med-surg systems do my lab work for me. They do, and sometimes pharmacy. So there's lots of different relationships we have with med-surg systems.
I think what you were talking about is in the slideshow, when I mentioned the potential partnership with the psychiatric residency program. So one of the criteria with which we evaluate a particular market is availability of psychiatric prescribers. And the fact that UW has a residency program here in town is actually a real benefit to a facility like this, because it allows us to have a greater ability to recruit from the local community and try to establish a relationship with the Department of Psychiatry so that we could be an institution where they can do rounds.
They can train.
Other questions? Well, Kurt?
We should do the
Yeah,
hearing,
here's
yeah.
Yeah, we are going to, okay.
People that we have.
So, well, thank you, Jim, and thank you, Mike. So now these are the, well, this is a public hearing. We're going to start with Mark
Email.
Imban. And you have 3 minutes. State your name and address and
Good evening. My name is Mark Keenbaum. I'm on the Primrose School of Middleton at 3000 Deming Way in Middleton. Just coming to voice opposition to the use of that particular property for the hospital, given what we're talking about being Plan Commission. I'm not here to debate the need for psychiatric and mental health facilities in the area. I know it's a need in Dane County. I just don't feel that particular lot's the best use for that. So also here to learn about the overall project. So thank you.
thank you, Mark. So the next one is Tom Gilbert.
It was Tom Gilbert who was called.
Yeah, no, I'm missing NCIS by being here, so this is important. Don Damon, 7201 Nightingale Lane in Middleton, ex-council member and you name it. But haven't been here for a long time. It's good to see everybody. We're still working. But I have no problem with the facility. It's well needed, it's well situated, it's located properly. I guess I'm more interested in the TIF money that might be going into this. I read in the paper, our own paper, I think, $1.2 million of TIF money is going to be requested. We've used TIF money in Middleton very wisely throughout the years. I wish I knew how much TIF money is still out there that might be retired in the next few years to go back on the tax base before any more is given out. Eileen, can you answer that?
Go ahead and answer it.
Yes.
We've had 4 subtractions from TIF number 3, and they total $374 million worth of property. So that's returning like 5 million or 6 million, I can't remember the exact amount, per year in actual tax revenue.
Well, that's one of my concerns as a taxpayer. But I do not object to a facility like this in our community. Thank you.
Thank you, Don. I appreciate that. Tom?
Thank you. My name is Tom Gilbert. I live at 1206 Falcon Court here in Middleton. And I am very much in favor of a facility like this in our community. I come to that perspective. My wife and I are the adoptive parents of 2 sons who have mental health issues. One of them severe. One of them is well known to the Middleton police because of mental health crises that he has. And because of the lack of a facility like this and other issues that I could talk to you about for 30 minutes, he ends up in the county jail because there is not a place to take him like the services that they are promising will be part of this facility. That gap is why the county is doing a study about to get underway of the gaps of these kinds of services in our community. And I know some people get concerned about these kinds of facilities and where they're located. People with mental health issues are not criminals. But because of the lack of services like this, we end up making them criminals by taking them and booking them with charges into the county jail when what they really need are mental health services in a crisis situation. And I'm very glad to see services like this come to our community. I'm also a very active member of Moses here in Dane County that is working for criminal justice and prison reform issues locally and on a statewide basis through the statewide affiliate Wisdom. And we are very much in favor of these kinds of services. We're working hard to see that they come to our community. Thank you.
Thank you, Tom. So the next one is Joe Oyama Miller.
My name is Joeyama Miller. I live at 4903 Roygan Terrace in Monona. I'm not a Middleton resident, but I have been involved in community mental health for over 40 years, both on a professional and as well as a personal family issue. One of the things that I really want people to understand, if they don't understand it now, Madison and its greater community has prided itself since in the mid-1960s as a community mental health community with the least restrictive for all of our families and our loved ones, which means that those going to hospitals or residential care is at the last end. It's the final end when you can't control or you can't have to do it. One of the things I've worked on tremendously over the years is to make sure that every family and communities are aware of all the community mental health services and that we need more of those. I'm a trained and certified teacher from NAMI, working with families who experience first-time psychosis, because I can remember what it was like when our loved one had his first mental breakdown. Not just a breakdown, but forensically, which meant putting him into the legal system. And we didn't have anybody to turn to. NAMI was just beginning. People were talking about it. And so for the last 40 years, I've worked with NAMI and NAMI families to say, let's create programs and education for as many people as we can, and that we use these hospitals. Our hospitals currently that he showed up on the screen are meant to help us when we need them for a minimum care. And while we need long-term psychiatric care, it isn't for these hospitals just to pop up because they think we need beds. We need to be sure that the treatment is proper, that when he talked about that the people going to his hospitals are involuntary. The state of Wisconsin has one of the best laws to make sure that people who have to go in have all the rules and regulations of involuntary commitment. Families, individuals, to Chapter 51. My mother-in-law was a state legislator at that time, and it was very hard for her because it was her loved one that was in a hospital. And she really worked to make sure that they weren't taken involuntarily. She wanted to make sure that all the steps were going to be available to every family. And while our gentlemen from the hospital say that they learned from their mistakes, I still am concerned because I was one of those that looked at the background. I've spent days, hours looking at not just their hospitals, but Rogers Memorial Hospital, the UW Psychiatric Care, St. Mary's Psychiatric. What pops up on the internet? What kinds of violation? I've talked to the people at Green Bay concerning about, because I saw patterns in this hospital organization, not just one state of North Carolina, but in Texas, in Colorado, New Mexico, that tells me we need to do more homework before we automatically give them or ask them to satisfy our questions a lot more before you give an organization. It is true, all of these rules and regulations for hospitals are mandated by the state. But I can tell you, because I've worked with other hospitals, we don't have a state regulatory unit like we used to. Cuts have taken away the number of visits, the number of places and times that they can see. So of course, there's going to be slippage. There's going to be where poor care is taken care of. And I can tell you from the person, It isn't worth one individual having one instance of some of the things that have come out, not just in the newspaper report we saw, but through all these different states. So if you spend the time looking in New Mexico, looking in Texas, looking at all the articles that have come back, it forces you to think very strongly and to come back before public hearings and say, please do your homework. There is no rush. One of the concerns that I just had is the gentleman said that the building in Iowa won't occur for a while. I just read you broke ground. Is the newspaper incorrect? When you say it's not going to be built, if they're breaking ground, it doesn't take 2 years. So I am concerned about the validity and the voice that the individuals have presented here. And I just ask the City Council of Middleton and your Plan Commission to do as much homework and research. And if you need help, I'll be glad to assist you. Thank you.
Joe. Really appreciate that. Do you want to address this?
Are we allowed to respond?
Go ahead.
Certainly. I specifically said the reason that Bettendorf is going to take us long, yes, the groundbreaking is 2 days from now, is because of the winter. And the permitting process in Bettendorf, Iowa is different than the permitting process in Madison and in Middleton. And so Middleton will take, once we put a shovel in the ground, 1 year. But the timing of that facility will be about 18 months. It has to do with when you put the shovel in the ground. You guys understand that in the winter. You can't do certain things in the winter. That's what's stretching the Bettendorf out, not stand here saying we're not going to do it. I mean, that just wasn't, that's why.
Okay.
This is Mike Garone with Strategic Behavioral Health. I want to make sure that you understand the breadth of our services extends beyond inpatient care. So we offer a variety of outpatient services to meet people at their desired treatment modality. So whether it be intensive outpatient or partial hospitalization. And we spent a considerable amount of time with Lynn, who's the CEO of Journey Mental Health Center, with Nate, who's the executive director of NAMI Wisconsin, with Lindsay, who's the executive director of NAMI Dane County. We always enforce the mode of least restrictive environment of care. Just because we're a hospital company and that's the majority of what we do, that doesn't mean we're trying to put everybody in the hospital. And the second thing is that when we have our facility open, we'll have a 24/7, 365 crisis level of care assessment that will allow anybody to come in, get a crisis level of care assessment with a trained professional, free of charge, to try to help them navigate a very complex system. So trying to get them hooked up with what's the most appropriate course. Maybe 30% of all the individuals that we assess at all of our facilities actually get admitted. The other 70%, we're working with these wraparound services to try to get them in the least restrictive environment of care in a community-based setting. So I thought that was important to share with you.
Thank you, Mike. So the next speaker is Stephanie Speaker.
Hello, my name is Stephanie Speaker, and I am here as a Middleton resident. I live at 7128 Park Shores Court. I'm also here as a mother. The lack of mental health resources in our area affects me and my family in a deeply personal way. A few years ago, my oldest child had just turned 18 and was a senior in high school. He played the trumpet in the band, had been in his high school musical, on the soccer and tennis teams. He had nearly completed a math minor at UW while still in high school and had been accepted to the UW-Madison Computer Science program. Then he suffered a major depressive episode. I was told to take him to the Journey Mental Health Center Crisis Center, where they determined that he needed to be hospitalized. While at Meritor's Child and Adolescent Psychiatric Hospital, he was trembling, staring at his feet, and non-responsive. Since he had turned 18, I could not sign his admission form for him. He had to be an involuntary commitment. The police were called, and I was told that he would be taken to a facility 3 hours north, Winnebago, which was mentioned earlier. I was told that I could not go with him. There were not any beds available in the local area, which is why they needed to take him north, and I was told this happened frequently. He would be taken for 3 hours in the back of a squad car. And I was told it could take hours to process him once he got there, and it was already 8 p.m. I went from feeling exhausted and nervous to terrified. There was nothing I could do to help my child, and I couldn't even be with him. Fortunately, my son signed the admission form at the last minute, and he was able to stay in Madison. I saw him during visiting hours every day. I could participate in the conference calls between his treatment team and high school teachers and meet his therapists and doctors. He told me later that even though he could not respond to me during the first several visits, he knew I was there. He could hear me singing and talking to him, and he could feel me rubbing his back, and he said it gave him hope. I did not know when my son was young that someday he would need these services. My experience is not unique. I am also a mental health professional, and I hear an all too common story of people who are turned away from our county mental health center because the waiting list is too long or closed. My own child was on a waiting list for services for nearly a year, and even after released from the hospital, waited over 6 months to get his own psychiatrist, during which time he grew worse again. Mental health crises are common. Our children, neighbors, and friends with mental health issues are people with an illness who need treatment, not dangerous criminals. And no one deserves to be suffering for months at a time when there is treatment. We have an opportunity to help Middleton and area residents. If this facility is properly designed and operated, it should be able to be located anywhere in this community. I cannot justify letting fear of a potential future hospital infraction stop a process that would give hundreds upon hundreds of people the help they desperately need today.
Thank you, Stephanie. So the next one is Dr. Randall Cullen.
Thank you. I could talk for about 3 hours, so I'm going to try to cut it down. I'm sorry for that, but thanks for the opportunity. Name is Randall Cullen. I'm a psychiatrist in the Madison area for the last 28 years or so. I've been the medical director at Mendota. I was the medical director of the private for-profit hospital, HCA, back in the late 80s, early 90s. I've been a medical director in a general hospital, Mercy Care, or Mercy in Janesville. And I've developed several inpatient, outpatient, child and adult units in my varied career. I wanted to speak to a couple things we have to understand. I'm kind of concerned, we've lost the certificate of need process in Wisconsin. It used to be that the quality of an institution like this would get reviewed by a community in a larger place. So I feel like I'm trying to mold a discussion here in a planning commission meeting about a lot of issues that are outside the strict purview, perhaps, of planning. And that's unfortunate because we are in the middle of waiting for a Dane County evaluation of the mental health needs in this community. I feel strongly that Middleton jumping in with a for-profit hospital on the edge without all these the bigger picture being taken into consideration, I think is a huge issue. For example, we have three not-for-profit hospitals in town, the University, St. Mary's, and Unity Point, all of whom operate psychiatric units. And I would think that a community wishing to solve these problems, maybe initiated by a mayor of Middleton or a mayor of Madison or all of the above, would participate in the Dane County planning process to look at what are our mental health needs, how can the not-for-profits work together to come up with a community-minded solution that takes into several of the concerns. For example, the woman, Yama, I think your last name is, in the last 20 years, psychiatry is not moving to more bricks and mortar. It plays well with the crowd. It's a great sales pitch. We need more bricks and mortar. That'll solve our problem. but Dane County has a long history of trying its best to keep people out of hospitals and see them in their home. We need money for in-home treatment. We need money for day treatment. We need money to evaluate people in their community and keep them in their community. We do not need a lot of money, 17, 20 million, very generous, by the way, to just put people behind bricks and mortar. I don't think that's the way that good mental health care is headed. So let me quickly speak to the whole Parkway experience, because I was the medical director at Parkway, an HCA hospital. I'm sure the CEO, the owner of all these hospitals, as he describes himself, is very well aware of the HCA experience, being from Tennessee as well. That hospital, I was medical director there, it's all about the profit. It's about, what's our census? Every day I get a call from somewhere in Tennessee, what's the census? What's the census? What's the census? Go ahead and find us some people. Go market. We got to find more people. Market to Rock County, market to Sauk County, market to Adams County. Bring them in by the hordes. We need them. We have to have that census. This company is all about the profit generated by the census. And that profit, I'm telling you my experience.
Yeah, just a minute.
My experience
Everybody
with
will have a chance
for-profit
to address.
hospitals is exactly about this. The beds must be filled. That's where our profit's going to come from. If the beds aren't filled, we aren't making our money. How else do you cut your profits? Well, or how do you make your profits? You cut your census. All those citations that you've read about are all about staffing ratios. It's all about cutting that staff to the barest bone so you can make the most money per patient per day in your institution. So Parkway, unfortunately, and it's kind of odd to me, I haven't seen anything about the HMOs involved in this, but the reason Parkway failed, and I would say you dismissed that all those psych hospitals must have been horribly planned. They were horribly planned. The for-profit system saw must be a lot of money out there in those psych hospitals, so let's build hundreds of them. Well, here in Dane County, they miscalculated. Hospital Corporation America, who currently runs a lot of general hospitals throughout the South especially, and I'm sure is doing very well. That process here in Dane County, they miscalculated. Almost 80–90% of our population is covered by an HMO. HCA built a hospital and didn't think that they had to have a contract with a single HMO. It only took 2 years for that business model to fall flat because there were no contracts. Without contracts, there weren't patients. I'm very curious how a Quartz or a St. Mary's or a Unity Point, all, by the way, owners of insurance plans, are going to justify sending their HMO patients out of their system. I would think their first priority would be to fill their system. And I also think they would probably be interested in part of the community discussion of how to keep the patients and the money in their system versus sending it to Tennessee, because that's where the profit's going. It's not staying in Dane County with this group. So I think they miscalculated. I'm concerned this group is miscalculating the HMO penetration in this area. That leaves them the Medicaid patients, and it leaves them the non-payers. I'm pretty sure their business plan isn't geared around making $1 out of non-insured patients. So it's quite impressive. They've told us, well, we'll take everybody. In fact, you can walk in and get an evaluation in the middle of the night. Well, I'm psychotic, maybe I feel like killing myself, I'll just walk over there and get an evaluation. I mean, it sounds really nice. This is a sales pitch. It needs to be taken as a sales pitch. It's completely a selling job, and they are operating on various emotions such as, we'll take care of you, don't worry, no problem. You want day treatment? No problem. Well, and the sheriffs, I'm sure the sheriff's department likes this because they don't have to drive to Winnebago anymore. Well, understandably, no sheriff, I worked with several counties in this state, no sheriff in any county likes to take their time to drive somebody to a Winnebago. But that doesn't mean that this is the solution. It's like they're selling us, everybody's hungry in the world, we'll give you beans, lots of beans, there, aren't you satisfied? But we really need some protein, we need some carbs, we need some fluid, we need some vitamins. We need a lot of things, and the Dane County process is trying to figure this out. So I would suggest this should be on hold. We should see what their actual business plan has to do with profit margins, patient mix, who are the payers, where are the contracts with the HMO that actually even guarantees that your public money is ever going to be worth anything. I think it's a public funded thing that we have a say in the quality, and these questions are not minor, they're not just for a planning commission. They're immensely important. There's much more to say. I'm sorry I don't have more time. Hopefully there's other forums.
Really appreciate that. I appreciate your
Can I
interest.
ask a technical follow-up question? What is a certificate of need process?
Well, it used to be that, like, for instance, they ran up against this in Iowa. Iowa has a certificate of need. It's a community-related process where you decide, what is the argument really for the need for this bed? So all parties have a say.
Doesn't the state healthcare accreditation agency do that?
Not anymore, I don't think, in Wisconsin. And they ran into this in Iowa, and so there was Unity Point, in fact, was one of their main adversaries in their discussion in the Quad Cities, because Unity Point also at Meriter has a hospital in the Quad Cities, and they and the other not-for-profit hospitals all got together and were opposing this, and then it went to the state level, and I think it ended up being a political issue. And it is a political issue. Just like this quote, I'll just end with this quote unquote. I thought this was perfect. This is from Richard Curtis. It's just as plausible that some of these citations are the result of all the variables, inadequacies, and problems of the whole survey and certification process. In other words, they're sort of saying, well, that's all fake news. We don't really, wasn't really substantive. And so I think you have to be really, it's public monies. There's a lot of questions to be asked. The for-profit business is different than the not-for-profit business. And a general hospital has a lot of resources. They can shift staff from other units. They can take care of their sick people immediately, and they can bring other resources to bear that a for-profit is not going to have. And the psychiatric residency, we thought we'd do that at Parkway, by the way, a long time ago. The psychiatric residency was not interested in, I was assumed, they don't even have enough residents to supply current retiring psychiatrists. I don't think they're all going to rush over to Miramont. So there are many, many questions. I hope you'll really think hard, and I hope there's another forum. And I would like to see us wait till the Dane County process has wended its way to see where this might fall in. Maybe at that point, maybe it's a great thing, but maybe it's not.
Thank you. Really appreciate that. So the next one is Don Ames.
Thank you, Mayor Breyer and members of the Plan Commission. I am here tonight because my last job was with the state of Wisconsin, the Bureau of Housing, and I worked in special needs housing. And my job was to go around the state of Wisconsin and inspect homeless service providers and who are receiving federal and state grants. And so I had the opportunity to meet a lot of homeless people and talk to them and talk to the providers that are trying to help them. In Middleton, I spent about 5 years working on the Middleton Outreach Ministry Board of Directors and in the food pantry. And for the last 11 years, I've been working with the Bethel Lutheran Church Homeless Ministry. And so I'm here tonight to talk about homeless people a little bit and why they need mental assistance, mental health care. In many cases, they don't have family that can support them. They don't have any money. They don't have any food in some cases. They don't have any clothing. They don't have anybody who cares about them. And they get in crisis situations and they don't know what to do or where to go or who can help them. As it's already been pointed out, the Dane County Journey Facility is booked solid. You can't get in there almost. When a person who is mentally ill goes to jail or prison and they are released, they're released on the street, usually in downtown Madison, with no medications, no counseling, no assistance. It's very difficult for them to try to live like this. And so I've been to Winnebago, and I've visited people, homeless people from Madison who are in Winnebago. I know what that facility is like. It's a prison, a mental health prison. It's not a mental health hospital. The things that I think when we're talking about staffing for this hospital, it's not a question about having adequate staffing. It's a question about having staff that have the proper education and the proper training. You can find people with a big heart who would like to help the mentally ill, and maybe they've majored in English or Russian or whatever, but they have no education or training that they need to help the mentally ill. So that's one thing I would check for sure. I think there's, personally, I see nothing wrong with being a for-profit business. I think for-profit businesses often do a good job, and I don't think that we necessarily have to have a non-profit business, although I have no objections against non-profit businesses. This business community we have has both profit and non-profit. So I don't think I would go along with any criticism just because they're a for-profit business. I think one thing that needs to be done too, it's one thing to have laws and regulations, it's another thing to enforce them. We have lots of laws and regulations, and most often we don't have the staff or the funding to enforce those laws and regulations. And so if this hospital is saying to you, don't worry, we've got laws and regulations that will make sure we're doing exactly what we're supposed to do, take that with a little grain of salt, because either the city or the state or the county or somebody has to make sure that those laws and regulations are being enforced. I've been to lots of places where the staffing was inadequate in terms of training, education, and the number of staff for the level of patients that are there. Last thing, homeless people, for the most part, their health insurance is with Badger Care and Medicaid. And I have seen them turned down at St. Mary's because they're on Medicaid and Badger Care. Don't tell me that we have 3 hospitals that'll take in people with mental illness that have no insurance or don't have money, because I've personally witnessed them being turned down. We don't have adequate mental health treatment centers here in Dane County. And I don't go along with the gentleman who said we don't need bricks and mortar. When there is a crisis situation, we can't let the ERs at our hospitals be the solution to mental health crisis situations. It just doesn't work. They get treated for a short time, maybe a few hours, maybe a night, and pushed out on the street, again, with no medication, no counseling, no assistance. So I would just like to speak maybe another 30 minutes, Gerda.
Oh,
But
another time.
I could say a lot more.
I know.
I think we'd be very lucky to have this
Maybe
facility.
we can meet for a cup of tea or coffee, so.
I'd like that.
Thank you, Don. Anyone else who would like to speak? Thank you. Yeah, the chief.
Thanks, Mayor.
Mhm.
Planning Commission members. One thing I'd just like to say off the top is the brick and mortar buildings in Dane County is the Dane County Jail. And that's the absolute worst place to put somebody in a mental health crisis. I am supportive of the proposed strategic behavioral health project in the Airport Road Business Park on Deming Way. There really cannot be any debate that our mental health system and dealing with people in crisis situations is broken. Nationally, statewide, and certainly in Dane County. And people have very eloquently explained some of those issues tonight. And I'd be happy to expound upon that to anyone at any time. The issue is not if we need additional mental health services in Dane County, because we do. The issue is strategic behavioral health the correct entity to provide those services, and whether the Airport Road Business Park is the right venue for such a facility. Based on my knowledge of the shortages in the area, my dealings with staff from BSH, and my inquiries from my colleagues in Green Bay and Brown County, I am convinced that this project should be approved. I do not believe that the placement of this facility in the Airport Road Business Park will be a safety issue, and I feel that SBH will be a good community partner. I'm not alone in this opinion. SBH has worked closely with local, county, and state officials in both Dane and Brown counties. Locally, SBH is supported by the Dane County Chiefs of Police Association, Dane County Human Services, Journey Mental Health, hospital officials, NAMI, and other mental health advocates. The article in Sunday's Wisconsin State Journal, and of course timing is everything, was not a surprise. Anybody that looks on the internet can find things like that. I didn't know all those specifics, but in previous meetings, SBH has been frank and forthcoming on these issues, and they've detailed their responses much like they did tonight. And we have had neighborhood meetings, we've had city council meetings on this, and their response has been very similar. Some of these issues were, of course, concerning, and they demand answers and need to be addressed. Some were more technical regulatory issues, which I do not intend to downplay, but which I would argue are not issues that would endanger the public. Would you or your business want to be defined by what is found on a Google search or an open records request to the local police department? There are local businesses, employees of those businesses, and patrons who do not have spotless records, yet for the most part they are good community partners. I would urge you not to use this newspaper article as an excuse to prevent a needed service in our community. Again, I would be willing to discuss this with anyone, either in person or in a group setting. Look me up, middletonpd.com. There's my number, my email address. Happy to talk to anybody. But Plan Commission, given your mandate, there is no reason not to pass this proposal tonight, and I would ask you to take action on it and pass it, and I would also encourage the City Council to do the same. Thanks.
If I have a question for
Yes,
you.
sir.
Yeah. To begin with, I want to say you have done a great job in making and keeping Middleton safe, and you ask any citizen there, and folks in Middleton really feel safe, and you have done a great job with that one. Now, I think we all agree that there's a need for the mental health facility in Middleton. Now, question, not in Dane County. Now, the question for you is that how would this proposed facility affect the safety in your department, especially this actual and perceived safety by the citizens?
Well, the truth of the matter is that now with the difficulties and the many roadblocks that people have in a mental health crisis, they're not getting treatment at all. I think this is yet one more piece of the puzzle that would add us more ability to get people into treatment. Much like the woman explained, we now have to take all of our emergency commitments to Winnebago, which is in Oshkosh, because the state closed the nearby Mendota Mental Health facility. Many people don't want to do that. Many of their families don't want them to go. They're taken away from their families and what support systems they have. So I think this would open up people being more apt to get treatment and would make things safer then. Most of the people that we deal with in a mental health crisis get no help. They go to the emergency room, as somebody else said, they're quickly turned back out onto the street, or we arrest them and take them to jail. And that's why Dane County is spending millions of dollars to upgrade their jail, because it's an inhumane, uncivilized place to put people in a mental health crisis. And I can tell you that my friend Sheriff Dave Mahoney would agree with that and has made that very statement. So I think it just opens up another option for us to take people that are in a mental health crisis, and in the long run, our general community, our Dane County community and surrounding counties will be safer for that.
Okay, any questions for Chief? So you think that Middleton would also be safer by having this facility?
Well, I
here?
do, and I did contact my colleagues in Brown County and Green Bay, who are both professional colleagues and, in some cases, personal friends. So I feel confident in the answers that they gave me. There's very little call for service by the police at these facilities. In other words, once somebody gets there and is transferred and is into their facility, they don't call the police because a situation gets out of the control or they can't handle it. I checked with Brown County and Green Bay because that's comparing apples to apples. Do I care what happened in North Carolina? Of course I do. That's a completely different model, a completely different facility, and it's not something that we're going to have to deal with here in Middleton. In Green Bay, again, they do not get calls for service by the police. So I'm very confident that once a police officer or an ambulance or a family member takes someone to that facility, that it's not going to be a burden upon the Middleton Police Department to respond to calls for service there.
Okay, thank you, Chief. Okay, so
Thank
the
you.
next speaker is Susan West.
Okay, I'm here mainly to ask for us to slow down and take some time. I've had several people reach out to me from the Madison psychiatric community and actually even a retired Dane County Circuit judge. I would like to read his email to me because I think it clearly doesn't necessarily clearly explain, but we have to be sure that we get the interactions with the medical community correct for this to be successful. And I am not convinced that City Council, city staff, Plan Commission have all the knowledge in terms of the medical issues and interaction with all the various, and not to be too critical of you, but with the medical community. So I think it's important that we do slow down and get that work, to be sure that it works well. The person I got the email from is Mark Frankel. He's a retired circuit court judge. He's lived in Middleton. He no longer does, but he was a circuit court judge for 20 years. He cares about the proper functioning of our mental health system. And he has discussed the proposal with a good friend, Dr. Ken Robbins, an extremely well-qualified psychiatrist who resides in Madison, who was formerly head of psychiatry for Dean, medical director at Mendota Health Center, and started the first children's psychiatric hospital on the west side of Madison. He currently serves as medical director for the largest provider of psychiatric hospital services in the state of California. He has substantial concerns that the Middleton Psychiatric Hospital has not been well thought out and may result in a long-term overall degradation in hospitalized psychiatric care services in this area. I have talked with Dr. Robbins. He's explained to me some of the issues, and even though I was at the vet school and have interacted with a lot of the physicians at UW, I'm still not knowledgeable enough to fully interpret this. But I am concerned that we do need to have all of the medical entities in this area on board, especially the HMOs. They control most of the insurance for most of the people. If they aren't cooperating, it could greatly affect strategic behavioral health's position. They also are going to need medical care or access to medical care at different times. That needs to be worked out. I am a little concerned that they've implied that there might be an agreement with UW for training residents. From what I've understood, or from actually their own admission, they haven't actually contacted UW yet on that. Is that correct?
We look at the possibility for.
Yeah, it's a possibility, but it hasn't been addressed. And I have talked to one of the members of the board of directors for Journey, and he has also cleared this with their CEO that they, at this point, have decided not to take a stand, either positive or negative. So I think with that bit of information, I am concerned that we need to sit down, spend some time with the medical community and strategic behavioral health and be sure we're getting everything right, because this is way too important a need for the community. There's clearly a need for additional mental health care. I have no qualms with that. I just want to be sure that we aren't rushing into it.
Thank you, Susan.
So I would suggest that we defer for a while and get some more information.
So I have a question for Mike and Jim. So you don't really have any problem if we spend some time thinking about it? I mean, a couple of weeks doesn't really affect you a whole lot, right?
Well, I mean, I guess we certainly would like to see action tonight, but I guess I would like to say I certainly agree with the councilwoman around the conversations with the medical surgical systems. But let's be very clear. They have emergency rooms and physicians that we will be working with if a patient is in medical crisis with us. In addition, we will have our own internal medicine physicians there. But to ask them whether they want a competitor to come into town, what do you think the answer is going to be?
Yeah.
So, I mean, to think that, you know, I mean, we are absolutely will work with them in the emergency room, and we will, but that's.
Let's
We
get
know what they're
together
gonna
and
say, so.
let's get together and discuss those things. We don't want to get into discussion here, but I think you know, digesting all what we have taken here in next couple of weeks, and that really doesn't hurt. It probably would improve the process, at least what I think. So
Yeah, actually, you brought up one of my concerns is knowing what positions of staff people you have or will have. And so far, at least as far as council, I haven't gotten a feeling for how many psychiatrists, how many, say, internal medicine people, how many, and those, and what their salaries are, and so on. And that's information that doesn't need to be.
Yeah, we can work out those details. So let's.
Okay, council hasn't seen it.
Yes,
Okay.
yes.
They
Can I
did-
ask-
They did submit that, and it's extremely detailed. It has from year 1 to year 5 as they ramp up, the total number of FTEs, the
I
salary
think that's
range.
information that council and plan commission need to look at.
Yes, yes. I think you got really good ideas, Susan, and I agree with you. So Kurt, you have something to say?
Can I ask Alderperson West a question? It relates to a lot of the concerns that people have, which is way above my pay grade in terms of medical integration and psychiatry. What is your understanding of the legal basis for us to regulate an applicant's business model under a conditional use permit process?
My question, too.
I mean, these
Yes, that I
are
don't know.
issues for CMS and Joint Council and state health regulators. I don't know if there's enough medical psychiatric beds in the county. I don't have that expertise. But we're approving a conditional use permit for a hospital,
Right.
which, if it doesn't work out, could be converted to other medical uses in that facility. So the difficulty is people are asking us to weigh in on all these deep questions when what's before us is a zoning issue of a conditional use permit, right?
Yeah, that's true. And I will say the psychiatrists I have talked to have expressed that very lack of knowledge. They don't understand the zoning issues.
Right.
I would just like us to take a week or so. They have said they're willing to work with us. and just get more information so that we can make a good informed decision and make sure it works. I mean, I've got myself, if strategic behavioral health doesn't succeed, transforming that into a business could be a little more difficult. It's not as easy, I don't think.
I think we discussed that
Yes, and we need to,
separately, I think,
this
yeah.
is not appropriate for
Yes.
here.
Okay.
But I'm just
Any-
asking, take some time, please.
Any other, okay, Cindy?
I was the Plan Commission member that asked, and thank you, Abby, for the explanation you gave, and what I'm gonna say agrees with what Kurt just said. Our job is appropriate land use, and approving conditional use permits if that seems appropriate. And there may be a lot of issues to talk about here. We certainly have heard a lot of interesting things tonight, but I can't answer those questions. That's not what I know about. And maybe the appropriate thing to do is to defer action on these motions tonight, because somebody's gotta talk about all these issues that have been raised, but that is clearly not the responsibility of the Plan Commission.
Yep.
And I don't have the knowledge to
Right.
do that.
And in fact, it may be the case that much of microregulation of someone's business model as part of a zoning process is not lawful, because zoning regulates the use, not the user. So our question is a hospital a reasonable conditional use in this
Exactly.
location?
Exactly.
Now, we have a particular SIP for this particular facility, but, yeah.
Okay.
Another question.
Does anybody, oh, yes, Kathy?
Does anyone know the timeline for the Dane County study?
I do.
Yes, Mike.
This is Mike Garone for Miramont. I had a conversation with Lynn Green on Thursday of last week. Very good conversation with her and Todd, I can't remember his last name, who's over Adult Services. They put it out to bid. They haven't even secured a vendor for the RFP. So it's looking at probably well into 2018, maybe even 2019 before they have any quality data. And it's going to be a while.
Okay. Thank you, Mike. Anybody else have any questions? Otherwise, does anybody else want to speak? Go ahead.
I'd like to speak, please.
Sure.
Oh, at the mic.
Yeah, that's mine.
State your name and address.
Thank you. I'm Joel Tennyson. I'm the general manager at Hitter Sports Plex, directly across the street from the proposed site. My concern is more geared toward the actual zoning and planning of the facility and not feeling that it could be the best use. My biggest concern is the safety of hundreds of kids that come through my facility every day, and also the facility next door to me with the child care, and another sports facility around the block at Kiva. So we have two of the state's largest recreational facilities within a 1 or 2 block radius. In addition, we have 2 child care facilities within 2 or 3 blocks within New Primrose and the facility next door. So I just get concerned. I clearly want the community to have this great opportunity for more mental health. I'm just very concerned about the location and the logistics of it. We have hundreds of kids getting dropped off throughout the day at all these locations. We've also got bike trails that run between the daycare and Hitter Sportsplex that, to me, could be a convenient safety concern. Looking for the right words. It's just a lot of safety logistics, and I just get concerned. There's a lot of traffic that can come behind the buildings. We're going to get a lot more people from out of the area that are going to be utilizing Airport Road, and I'm just concerned about the logistics and the overall usage of the area. I would love to see this facility in a more industrial or a different location rather than a recreational and child care hub of the city. Thank you very much.
Thank you, Joe. Anyone else who wants to speak, who hasn't spoken before?
Could I just read something into the record then?
Yes,
Or-
go ahead. There is
We
a-
have, we have 3 emails that are at your desk from people that, one person has a concern, and that's the owner of the Hitters, just asking that you, just try to put in place something in the approval that says they'll follow the rules. And then 2 against, and I also had a phone call today from an Anna Spangler who lives on Old Sock Road in Madison, against the facility. We also have 9 people registered in opposition and 1 person registered in support, but those 10 people don't wish to speak. And they'll be listed completely in the minutes, who they are and their address, and if they're in opposition or in support.
Okay, anyone else still wants to speak? So I would think these are all the 3 public hearings, so not just one. Or do you want to have,
You need to have a second one.
If it was noticed, we have to have it.
oh, we do?
We have to call it to order.
The first one is for the GIP.
You have to close this one and then
Oh,
call it
okay.
to order.
I'm going to close this part of the hearing, and then we go on to the second part. It's way past 7:10, which is request for conditional use permit for a hospital, Airport Road, Business Park, lots 2 and 3, CSM 13300, Miramont Behavioral Health, 316069 Deming Way. Anybody who wants to speak on this part? Okay, so anybody else want to speak? Okay, I'm going to close this part of the hearing. So the next one is a request for, that's 7:45 hearing, request for rezoning from office district B1 to planned development district, general implementation plan. This is the Addison Ostringer mixed-use development on University Avenue. This is different than the other one. So this is the proposed facility on University Avenue, and there's a Caroline Matten, she would like to speak.
Is the applicant
Yeah,
going to do a short presentation?
You want to?
Or just at least?
Yeah, sure, that's
Can we
fine.
just run-
Yeah, go ahead.
I'm gonna take this one out. I'll just move this to the desktop.
And this is one person speaking. Is that
Yeah,
the person?
that's Caroline, I don't see her here.
And then we have people not wishing to speak.
Sorry, against this?
Closing.
This one?
Library board did, yeah.
Okay, so you're.
Just gonna have a sandwich.
Sure.
And I ate something at home before I went. I'm fine, I'm just tired.
Anybody in support to speak or no?
Wish to speak in opposition?
You want to go first? Yeah, that's right.
Evening.
Please identify yourself and, yeah, go ahead.
Yep. Mark Ott with JLA Architects here with Anthony Gray of Ostringer Capital. So we're back. For all those who don't remember or know, we were here a few weeks ago and got a conditional approval from this committee for our GDP PDD. There was a couple little minor items. I think one of the things tonight is the original legal description had to be updated and wasn't quite correct the first time, so that's, I think, part of tonight. And then the other item was our original public notice had 38 units, and through our continued market research and polishing of the plans, we'd like to go to 39 units. So I think that's one of the big things here that we're going through today too. And so just to go through the 38 and 39 issue, what that really is around is the early version that was submitted to you guys and was in front of you had a community room on the back side of the building. And as we looked at a building of this size and needs and best use of the property and of the space, we determined that a community room for a building this small really wasn't probably the best use of the space, and in turn really just put a additional 2-bedroom unit there in its place. So did not grow the building footprint, did not change any of the things, just polish the internals of it. So based on, again, the original notification being 38, we're hoping for 39. That's what we're asking approval for tonight. I'm going to take this off so I can see the monitor. The other thing that we've done, there's been 2 items that we've worked on since we were here last, and I don't see, is Yuli and Brian here?
They're not here.
Okay. So one of the things
They're not supportive.
I'll just jump back to that's come up. So as you see our property here on the site plan that has the loop to the back there, to the back of the property that comes into underground. So to create that driveway towards the back and to share with the neighbor to the west of us, we're utilizing an existing right-of-way ingress and egress easement. It's already there. Well, that easement actually goes back beyond our subject property and actually to the neighbor directly behind us. And so that neighbor approached us and said they would like us to look at our plan and make it such that they could still have access to use that ingress and egress if they ever so deem the need to get to their property. Because as you know, that block is very deep. And with how the houses are actually stacked up on the other side, there's really no easy way for them to get between buildings and garages back there if they were wanting to do something. So we worked with our civil engineer and just tweaked basically the grades and the layout of our retaining wall, in kind of aerial view here that you see. It probably doesn't really look any different, but we did maneuver the retaining wall and start our grade flow outside of that right of way. So with real ease in the future, if those neighbors wanted to then, at their cost, extend that drive into their property, it could be done versus the original, that had like a 4 to 6 foot retaining wall in that section. So that's one positive tweak. And based on our conversation with them, we're under the understanding that they're now in favor of our project. Since we've addressed that, obviously, too. The other thing is we will be putting landscaping and fence, and that'll be SIP level stuff that what the city wants to see there for headlight pollution, if you want to call it that. The other thing that we've worked on since we were here last is David, as one of the conditions, was still to work on the architecture along University Avenue. And so we met with David and Mark Opitz a couple weeks ago on some redesign elements. Again, as you guys are probably seeing around the city, construction costs are going gangbusters. Projects are getting tight, as by example of a project that's on the agenda for later tonight yet too. And so, one of the options was to lose units, reduce the height of the building along University Avenue as an option. And right now the market's just not allowing us to do that. So what could we do with the architecture to help ease that facade along there was kind of the question. So on your screen is kind of the redesign that we've come up with, that we worked with David on, that we think is a good middle ground on it. I'm going to just click back and forth here, and you can kind of see this was the original that we presented a couple weeks ago. And if I go back here, you can see just some of the slight tweaks we've made. So we've reduced some of the architecture of the decks on the corners. We've brought down some of the height overall along the street, just changed some of the materials to, again, help the top kind of fade back a little bit more and not bring so much emphasis to it. So
good job, David.
So again, if I just kind of click through them, you can kind of see just the comparisons. Original and proposed. And just another original and proposed. So those are kind of the highlights of what we're here for tonight. Everything else really is the same from our original presentation. And with that, I'll open it up to whoever wants to speak.
Okay, so the first
Virginia,
speaker
anything
is
you want to
Caroline Matron. Is Caroline here? Is Caroline here?
May have left. I don't see her here.
Okay, does anybody else want to speak? Okay, thank you, Van. Go ahead. So what do you want to do with this one?
Van Nutt, Middleton Chamber of Commerce. It's a good-looking project. As I said at the last council meeting, this is but the first of projects we're going to see like this on University Avenue over a period of time. And we just hope that this sets the bar for what's to come and the considerations for the next buildings on University Avenue can leverage the work that's been done on this one. Thank you.
Anyone else? So, okay, if there's no, yes, go ahead, please.
Joe Farron, 6912 Franklin Avenue. I live north of this building on Franklin Avenue, and this is going to be in my line of sight every day. And I don't feel a building this size is beneficial to this area of Middleton. Plus the fact this thing pushes right out to the sidewalk. How safe is that going to be for cars trying to get onto University Avenue? University Avenue in the morning rush and evening rush is difficult to get on as it is with a light. I just don't feel this is a good project for the area. Thank you.
Thank you, John. Anyone else who wants to speak? Yeah, go ahead.
Dave Anderson, 6924 Franklin Avenue. So I just found out about this project a little while ago. Apparently, we were notified, but I somehow missed it. I kind of agree with Joe. I think it's a little too big, but my feeling is the ship might have already sailed. One concern I have, especially based on the comment of that this could be the first of many such projects on that University Ave corridor there, is traffic flow, sort of like what Joe said. Like the picture here seems to imply the traffic can turn right or left towards Madison out of the building. My understanding is that that's not going to happen. And if we have a bunch of buildings on University, what I'm concerned about is when they come out of their, they're on the north side of University, they're going to turn right again, and quickly come down Franklin Ave. So Franklin Ave has, lots of kids, 20, 30 kids. So what I'm concerned about is the heavier traffic use on Franklin Ave. I don't know if this has been considered.
There's a
Go to the staff report with the
study in the process.
Okay.
So that'll
parcel maps nearby,
once that comes
just so
out,
they can identify their house.
part of the conditional approval.
So what does that mean? If there's a traffic study
Yeah,
that says
so let's,
for traffic, then what?
Yeah, there's a TI. Eileen, you want to take care of that? Why don't you just, they have issues with the traffic, so you want to talk about TIA?
Mark, is the
Oh,
TIA
Mark, you want-
completed?
The TIA is underway and will likely be completed in about 2 to 3 weeks.
So what does that mean exactly? So
Traffic impact analysis. So every time there's a rezoning of any significance, the city, we have a consultant that we have as not a retainer, but a consultant that we have an agreement with to do these analyses. So that was set in motion several weeks ago. They've done traffic counts, and the consultant is in the process of preparing the report.
And then, if you don't mind me following up, so I don't know much about this stuff. When the new report comes out, then what happens? I mean, is the project contingent on the outcome of the report, and then there'll be another hearing?
Yeah, they have to mitigate any adverse traffic impacts.
Ah, okay. So how will we be notified of that traffic study?
I feel there's not necessarily another hearing. In fact, there isn't normally another hearing.
Just give me a call. I'll call you when it comes in.
That sounds perfect.
And I was going to offer you to give me a call too.
I'll do both.
I just don't have my card handy. Sorry.
Can you, just for the record and the previous speaker, can you just show me which of these parcels on the screen up there?
addresses?
What's your address?
6924.
69.
I'm on the north side
you're
of
right on the corner.
Oh, so you're
on the
that
corner.
Okay.
Franklin Park.
The other one was.
No, I'm worried about traffic, not.
Two
Okay,
doors
so you're
to the east.
on the other. You're worried about traffic. not Franklin.
Okay.
You seem surprised. I'm worried about traffic. Why is that?
That will be the direction of traffic flow, we assume, since you
Yeah.
have to take a right out of that property, you're gonna have to go around the block to get back into downtown Madison.
I'm not saying I'm against the project. I'm saying I want the traffic to be.
Okay, so let's
Yeah.
one person at a
Well, left to
time,
go
and
out.
let's, thank you, sir. So,
I'm Dave's neighbor, Craig Burfield. I'm at 6709 Franklin Avenue. I am going to be right
Yeah.
in from my backyard. I'll be able to see this building. I do consider it to be kind of an eyesore. There are a lot of children in our neighborhood I'm worried about. I'm not at all thrilled about the traffic that I think will be going through our neighborhood. I think Dave pretty much hit all my worries.
okay.
Thank you.
And I just wanted to add that the reason, I looked in our records to see if these addresses have been notified. Do you both own your property?
Yes.
Yeah, I didn't see you in there. But the reason is because we notify people within 200 feet. And that's in fact, our requirement, I think, is 100, but we've always done 200. And you are beyond that limit, so.
You should be able to see that building from greater than 200 feet, I would assume.
Okay, so the next speaker, please.
My name is Sarah Cords. I'm at 6714 Franklin. I'm directly in front of Craig, so I can see it through Coolidge Court. I didn't want to speak tonight. I absolutely do not want to be speaking. But if it's going to set the tone for things along University Avenue, I really do want to say, if I wanted to live in an area of ridiculous urban density, I would move to an urban area like Monroe Street. That is available to me. I do not necessarily want this kind of density, and I have questions about if this sort of density and the traffic that this density leads to is already being, are these projects that have already gone up in town, most notably the one across from the Village Green, are they full? Is there a clamoring for all of this retail space, which by all accounts is going away? I read an article today. Retail is having a very tough time, so to just throw retail into it, especially in a place with no parking. I worked in a public underground, I understand. People do not like underground parking. It's hard for people with children, which is what you have here. It's hard for the elderly. I know because I've helped both those populations shop. The traffic, absolutely a concern. Are they gonna be whipping U's when they're coming University to get back in there? I go through that intersection 4 times a day. I don't want to in my car at Park and University, but I have to because it's unsafe for my 2 sons and I to get across that as a pedestrian. It's already a death intersection. If you want to be kind to bikers, pedestrians, which you always say you do, please do not put this much huge retail and housing of 1-bedroom apartments in this area. I've seen traffic accidents there. I've been behind them. I can't walk through it. Traffic a concern, retail a concern, any number of things that this leads to a concern. Thank you.
Thank you so much. Anyone else? Go ahead, Pat.
It's going to be a tough act to follow. My name is Pat Leedy. I'm at 1519 Middleton Street. I wasn't going to speak tonight either, but hearing that this is going to set the tone for the future of University Avenue just floors me. I mean, I'm really appalled at what's been going on downtown Middleton because, like the previous speaker, if I wanted to live in a dense urban area, I don't think I'd be in Middleton. But this growth is out of control. I don't want to see a 4-story building on University and then more and more to follow if that's the plan. I mean, University Avenue is very heavily traveled, and to make it even worse and to continue with this, I'm very opposed to that. Do we need a 4-story building there? Did we need these big buildings going up downtown Middleton? I'm really frustrated at the direction we're heading. So slow it down. Don't build so high. I mean, we're in a smaller community. So thank you for letting me speak. I'm just really surprised at what we're doing here. Thank you.
Thank you, Pat. Anyone else who wants to speak? Go ahead.
This just blows my mind. I've lived in Middleton for 59 years, and we've lost Middleton because of the construction that has been going on. The downtown, I would like to know where we park when we go down there. I'd like to know how many retail stores are in there now, how many apartments are rented there, and now you're thinking of another 4-story building right on University Avenue? No. You've lost Middleton and what Middleton was and what Middleton could be by the construction you're doing. You've got some ways to stop this here.
What's your name and address for the record?
Madeline Laufenberg, and I don't live anywhere near there. But my children grew up on Mayflower Drive, and it was a wonderful area back then.
Thank you, Madeline.
I recognize that for a lot of folks who live here in Middleton, it's very easy for you to say, we don't want development. We recognize that change is scary. But if you'll look at the plans that the city has for your city, you will see that that kind of densification, not over-densification, but greater densification, is part of the plan for the city. It's the way that you limit traffic. It's the way that you create access to public transportation. It is, in fact, the plan for Middleton.
Okay.
This wasn't something that
Thank you,
we
Anthony.
blue
That's-
skied. We were following the city's build plan.
Yeah, well, thank you. Thank you so much. So I appreciate that. Anyone else wants to speak on this topic?
I also don't want to speak, but I will really quickly. I'm at 6639 Franklin Avenue, and I grew up in that house, and I had the opportunity to buy it. And I can tell you right in my backyard, I have two complexes that offset my backyard that are 2 stories. I recently put up a 6-foot fence to provide a little bit of privacy, but no matter what you do, you always feel like there's people in your backyard. 4 stories only gonna be worse. I can't imagine being a single-family home having a tower in my backyard. That's
Thank you. Okay, anyone else who wants to speak? Okay, I'm going to close this part of the hearing as well. Now we move on to, so the item number 2. This is the SIP modification for Conservancy View subdivision for increased building height, Blue Line Design LLC, Chickahawk Trail. I think it's pretty simple. We have done 2, 3 of the same kind before, right?
Yes. It's similar. The difference here, and I don't think anybody's here for this item, is there? The applicant here? This one's a little bit different in that they don't have the upper level setback at all. And the previous one that we approved, that the Plan Commission approved a couple of months ago, was similar in that respect. There's others up there, other buildings where the upper level is setback, so it doesn't have as much of a, so it's a less stark, if you will, presence on the private street. That said, I walked up there the other day and took in how it's evolving, and the neighborhood association approved it. So if the neighborhood association is comfortable with it, the intent of the height limitation was to prevent new residences from blocking the view to the south, from Ramsey Road and also from the park that's nearby. And because of how the topography falls away from the park, in this case, this is not going to block the view from the hill. So our recommendation was approval as a minor SIP modification.
So I'll move approval of the building plan as a minor SIP modification.
I'll second.
Okay, any questions? Okay, so the motion is approve the SIP modification for Conservancy View subdivision 6763 Chickahawk Trail. All those in favor say aye.
Aye.
Anyone opposed? So the motion passes. So the next one is request for GIP amendment, Airport Road Business Park, lots 2 and 3. Do we want to, I guess couple of weeks don't make any difference. Do we want to take all those 3 items, or you want to deal with this? Or what do you?
Make a comment.
Yeah.
I'm not opposed to deferring them for a few weeks, but I would like some direction about what we're responsible for and who's gonna do what to kind of, figure out what the next steps are in solving problems or getting information before a decision is made. I'm not clear, if we just defer now without any direction, I'm not clear what's gonna happen.
Go ahead.
Well, I was just gonna say, well, I think that we talked about it earlier, and I think you also talked about it. The Plan Commission is looking at, is it appropriate to amend the general implementation plan for the Airport Road Business Park Plan Development District and add hospitals as a conditional use to that, for these 2 lots.
Right.
So if the Plan Commission makes that recommendation to the council, then the council would have to also approve it, in which case there could be a conditional use applied for those 2 lots. The issue of the conditional use, and I think Commissioner Paulson explained it, as did you, we're not looking at staffing, and Abby mentioned the expectation when a conditional use is approved, whether it's a restaurant, a gas station, or a hospital or a medical facility, is that all applicable rules at any level, local, county, state, federal, are met. And the Plan Commission looks at, as Commissioner Paulson said, the land use perspective. Does it fit in this location? And staff looked at where other psychiatric hospitals are located in Dane County. They're in neighborhoods. They're within hospitals, but they're in neighborhoods. And so this doesn't seem inappropriate within the Airport Road Business Park to add that. So I don't know if Abby and Mark or Kurt.
I just want to say, the question before us is whether to allow, the first question is whether to allow a hospital as a conditional use.
Right.
It's not to allow a psychiatric hospital or a geriatric hospital or an orthopedic hospital.
Right.
Because the general land use category that they're applying for is a hospital use, right? And I don't think we would ever imagine conditioning a conditional use on that it has to be occupied by that tenant in that particular business model. So that if in 5 or 20 years they sell it and someone wants to turn it into a surgery center or an orthopedic or an outpatient, dermatology clinic, it's a hospital-related use.
Right.
So I think one of the directions I would see is I'd like to see some interpretation from our legal counsel as to what is the basis for a lot of these conditions that people seem to want to attach based on the idea of it being a hospital use. Because those are a pretty unique land use, which are regulated entities at the state and the federal level that are way beyond our scope of authority in terms of zoning. Because the conditional use permit is for a hospital, not for a, in the same way that if we in zoning say it can be a restaurant, we can't say it has to be a Chinese restaurant, not a Mexican restaurant. We can't regulate business model.
Can I make another comment?
Sure.
Or really, what I want to do is ask a question. On Airport Road, there's a plot of land that was expected to be used for another hospital use at one point. Won't we be in the same?
No, this is not the,
That zoning's already been, that zoning's
That
already
zoning's been
attached.
approved. Yeah, okay, so we don't have to rezone that, okay.
and that's
So
not
it's-
the part of this business park, so.
No, I know,
it's
I know,
13
but
acres,
I was just wondering if there was a zoning change. I couldn't remember. Okay.
Okay, so then we need to consult with our
Wait, wait,
legal,
wait.
sorry, go ahead. Yes, David.
I don't know the answer to this myself. Why do we identify it as lots 2 and 3?
Because there was.
Are we not just adding it to the area?
No.
No, it's to those.
The conditional
Just
use
for
just to
this-
those lots.
Just for those specific sites.
Now, I think what we've done in the past is that when we're adding conditional uses in large business park areas where the person who has site control actually doesn't necessarily want every use everywhere, is that we attach a conditional use only to specific lots, which is what allows you to do in a PDD.
Yeah, we've done that.
Yeah,
So
we've done that a lot.
are you proposing then we need to consult with the legal folks then before we do
Well,
anything?
as part of Cindy's requirement, request that, what are we doing in the weeks that we're waiting?
Yeah.
Be nice to get
Okay.
some commentary
Yeah,
from legal.
Larry or whoever, so
Huh?
that would be
Matt.
Larry or Matt, so.
I'm concerned on the other side, if we deny a rezoning request or conditional use permit, based on how state law has changed on conditional use permits,
Yeah.
based on criteria that are outside of the realm of zoning,
Exactly. That's what I'm worried
we're
about.
actually interfering with someone's property rights that causes potential legal vulnerability.
That's what I'm concerned about. I don't want us being asked to make a decision on things that we don't have the authority to
Yeah.
decide.
Okay, so where do we go from here, so?
Well, can we,
If we defer,
Yeah,
what
okay.
what would
All
we
right.
learn in the 2 weeks?
So is that your motion then?
What would we learn in those 2 weeks that we don't already know?
Well, we will talk to Matt and Larry. That's what we will learn, so. They would have to pass some opinion.
we think we don't, I mean, I guess what it would be a clarification of their opinion about the basis upon which we should make our decision. I mean, I think we know it, but it probably wouldn't hurt to ask them.
Can I just make sure I have this, because you said it really well. Classification of their opinion. Clarification, sorry, that's with my glasses. Clarification of their opinion on the basis by which the plan commission should make their decision.
Yeah.
Would make their decision.
So that your
And the
motion?
council make the decision, because we're just recommending
Well, and
a
the council,
GIP amendment and a conditional use
Right.
permit.
Well, the conditional use permit rests with the plan commission unless there's an appeal to the council, and then it does go to the council.
But in some ways, if council decides that the GIP can be amended to allow this as a conditional use, that's implied acceptance of
Sure.
a granting of
That's true.
conditional use
That's
permit.
true.
Yeah.
And then our decision at the CUP level is, what are the conditions we want to attach
Right.
to the project approval?
right.
Okay, so that's the motion, so we need a second, right? It's for deferral?
Can someone actually
Did
make
someone make a
Do
motion?
we have to do it for each item separately, or could we do
Yes.
it for item 3, 4, and 5 together?
Well, we can
Well-
do all of these together, I think.
I'm going to make a motion to recommend approval to the council of adding a hospital as a conditional use on lots 2 and 3.
Any
To
hospital.
recommend to the council, yeah.
Okay, I'll second that. That makes sense.
So,
That's item number 3.
so do you want to make-
Recommend to council adding hospital as a conditional use on lots 2 and 3.
So do you want conditional with any opinion from Larry and Matt?
No, to add hospital as a conditional use.
Generic.
Okay, as a generic,
As
okay.
a
Then
conditional
Kurt,
use.
to look ahead,
But you're saying lot 2 and 3 and then conditional. That's not,
No, it's.
No.
oh, so you're
He's
talking about the whole
separating them
park?
out.
I'm separating them out, yeah.
Yeah.
Mayor,
We're,
he's
we're
sep-
working on item 3.
Oh, okay,
to look ahead, on item 4 is the meat of
Right.
our authority.
Right.
Yeah.
Okay. So item 3 is fine.
Right, so we're recommending to council,
That's the motion.
right?
okay.
Make a
Second.
GIP
So
amendment.
seconded.
Actually, it's item 2, I think.
Any discussion? Any questions? So do you want to read the motion again?
Sure. Moved by Paulson, seconded by Zellers to recommend to the common council to add hospitals as a conditional use for lots 2 and 3, CSM 13300
Okay,
in the airport district.
so all those in favor of that motion say aye.
Aye.
Anyone opposed? Okay, so the motion passes, so.
Then my next motion would be to defer consideration of the conditional use permit until we know whether it'll be a permitted conditional use
Okay,
from the council.
need a
Second.
second? Okay, any discussion? Okay, then the motion is to defer number 4. All those in favor say aye.
Aye.
Anyone opposed? So motion passes unanimously.
I mean, not to discuss a motion we've already approved, but it doesn't do us much good to go through a granting of a conditional use permit if it's not gonna be a conditional use allowed under the
Yeah,
zoning ordinance.
Yeah. Okay, so we can't really, so we have to, this is SIP, so,
Then we would,
so we will have to defer it, so,
SIP.
yeah, okay. So you want to make it that the same motion then?
Sure, I move to
Okay,
defer the
Okay.
SIP.
Any discussion? All those in favor say aye.
Aye.
Anyone opposed? So, all right, we are on to item number 6.
When you say defer, is there a timeline in which you're deferring, or?
No, it will be, well, it's, item number 3 is going to go to the city council to use that, to add the hospital as a conditional use. So if the city council approves it, then it comes back to the plan commission
For the next,
for those 2 items, so.
but can I amend my
Yeah, go
motion that,
ahead.
to defer until the next plan commission immediately following council action?
Okay. Okay, all those in favor with this amended motion say aye.
Aye.
Anyone opposed? So, okay, all right, so now you know it, so. So the next one is the SIP for Stagecoach Trail Apartments. So who's gonna take it?
Marcus, but you have an email at your place.
Thank you,
from-
guys, thank you for your time.
from
So we
Alex
are making
Cavalier
progress.
About the, just some suggestions or requests to the plan commission and the staff change. And Jacob, I have a copy for you.
So does anybody want to
Sorry.
say anything, or that's?
Mark has this.
Okay, Mark, you want to take it?
Sure. Actually, the applicant, there he is, Jacob Klein is here as well. You'll see in my staff comments, our staff comments, that we have reviewed the proposed revision to the footprint. We actually also discussed it with Vanderwall, so it's Jeff Maloney who does a lot of our, obviously assists us with our TIF projects in the city. And based on the collaboration with him and among staff, we identified, we assessed this change with respect to street edge, unit mix, parking, materials, building materials, stormwater management, which we didn't address, but we are pointing out that it needs to be addressed by our stormwater engineer and possibly Water Resources Commission if necessary, as well as landscaping. And our staff recommendation is to determine, for the commission to determine whether this constitutes a minor or major SFP modification. If it's major, it would go to the council for action as well. We do not object at the staff level to the site plan and building changes as long as the stormwater management plan meets or exceeds the specifications previously approved by the WRMC. And any motion to approve should be contingent on resolution of all staff comments. And I don't know if Jacob Klein wanted to share any of the conversation we had today, give us an update.
Can you pull up the rendering?
I'm trying. At
At the very least, we're giving your architect plenty of work to do.
Our laptop's hard drive crashed, so they give us this loaner, but it doesn't appear to be opening PDFs. It's trying to convert all the PDFs to Word.
Get to the G drive either, right?
You guys have it in front. You guys have.
Yeah, we have it all in front of us. Usually.
G drive, no. Oh, yeah, we do. We can get to it here, too. It's 25, or 35, or 40, I was forgetting which one.
What was it?
25, 35, or 25, 40. It's one of those.
Trying to resist cookies.
I'll take one.
Mark's having too many of the cookies. So let the record reflect. Mark's having all the cookies.
Hey, I don't want anyone to toss the cookies.
We're having the same problem.
I guess it's fair. Yeah.
That won't work.
Here we go. Oh.
No, it's trying to convert all the documents.
Because you don't have, yeah, you don't have reader installed.
I don't have the authority to do that. We have to have an administrator's
The
password,
IT.
so, sorry.
How do you have a computer without reader?
It's a brand-new laptop. I don't think. If it can do that.
Can go check, get hungry?
Yeah.
So I guess we'll just go off the packets, but basically, so we've got an L-shaped building, which was what was approved a couple months ago, and we kind of bid it out for construction. The cost came in high, as I think we're seeing a lot of people having, and so we kind of looked at, okay, well, what's the worst case scenario, like fallback position that we can still build, maintain the quality finish levels on the inside and keep the exterior the same. And so what you guys have is a straight shot building, a rectangular building. I think we took 60 feet or so off of the L, kept the architecture the same, changed the unit mix, and we changed, I think if you guys remember, a lot of this building is actually at grade. And so, there's substantial areas, I think on the east elevation up to like 12 feet where, it's essentially the basement wall is the exterior wall. And so what we're looking to do is anywhere that's under the first floor to switch that material from brick to a cement board, like a CMU blocks, basically. So essentially going from a 4-inch brick to a 8x16 CMU block for that first floor, and then brick above, and essentially the same cement board above that. And so what we're trying to get hopefully approved tonight is the straight shot building with the change to the CMU, and then let us work with staff on what the final kind of iteration of the building will be. Because where we're at today is, I think
What is CMU?
it's meant like a concrete block.
Oh, it's the material.
Yeah. It's a block instead of a brick, essentially. I went out and I got a second I've worked with the same general contractor on the last 4 projects, and This one I went out and actually then, after I got their number, went out and competitively bid it. And I've been working with subs for the past 2 weeks to try and get this thing in line. And I think we're to a point that basically we can still build the footprint, the building as it is now. Get rid of,
The L-shaped building is approved.
yeah, the L-shaped building is approved with the CMU on the first floor, and we'll get rid of the lofts. So we took about 5,000 square feet out of the building by getting rid of the loft space. So it doesn't change the way the building height is, what the exterior appearance is. It's just basically from that first floor down.
That's why I'm confused, is, are you proposing to modify the building footprint? Is your application today to modify the building footprint for the straight shot building? Or to alter the materials on the existing approved L-shaped building? Or are you seeking approval for both?
Kind of approval for both. Because I don't want to come back, you know, I'd hate to have to come back in a month. Right now, I think we've got it to where, I haven't signed the contract yet. I think I've got it to a point that it works with the block, with the existing building, and putting in substantially more of cash equity. But it gets to a point where it doesn't work. And so I don't want to come back in a month and say, hey, we need to take, you know, we need to get another 300,000 out of the building because of X, Y, and Z, and then have to.
But my opinion, somewhat informed by my expertise, is that changing the exterior of the building, the CMU, that's a minor SIP modification.
Yeah, I would.
But changing the footprint of the building, that's a major SIP modification which should go to council. So you might want to run on parallel tracks to have, can an SIP have multiple uses? I mean, multiple building configurations? Usually it's, the point of an SIP is it's a recorded plat.
I guess what we'd look for tonight then is just a minor modification, switching the material on from the first floor windows down to.
Yeah, that's a minor modification.
I'm fine with that.
The other one. Explain the what?
We're getting rid of the lofts. So like.
So there's nothing in the.
Yeah, so the building right now, so the building as it is right now, if you were to look at, I mean, it's a pitched roof, right? It's a very tall space. So we're utilizing, just like you would have an attic in your home, we utilize that truss space for.
Councilwoman on that map.
Yeah, we utilize, so right now, hidden behind all this shingles and roof pitch and everything else, there are lofts up there. There's, you know, dens and stuff that look down onto the floor plan. So architecturally, we've just essentially taken this cavernous area that's all wood and recouped some floor area in there. So it doesn't change the building architecture. You don't see it. There's nothing from the exterior that changes. What Jacob is proposing to do, because the costs are so high, is just eliminate that recouped area. So we're not building 5,000 square feet of floor area. It doesn't change one single thing on the exterior. The building will look 100% the same. It's just something we were trying to recoup an unused area, an attic like your house is about the best way I can explain it. Now we're just not finishing that space off, just to save some finished
Could I
square
ask
footage
you,
cost.
The rendering here is with the new material, or is this?
That one would be the.
Material.
This is the new material?
Yeah.
Yeah, it looks good.
And so what the CMU is, again, it's really mostly where you're going to notice it is on the face that faces the trail, I guess you'd call it. That side, because of how the grade slopes away, was all masonry. And it still is going to be masonry. We're just changing the size of the masonry from a small brick on the lower unit to a larger unit. And we're doing that for two reasons. What's that?
So it is a unit construction that you're talking.
So yeah, there's two reasons. Aesthetically, one, if we just changed it to a larger veneer module, right, we could still save some money in labor and cost, because the bigger the block, the less labor per square foot to put it up, right? In this case, because it's all above grade, we're actually going to switch that to what we call a single width wall through wall construction. So that block is the face, right? But it's also the supporting construction. It's kind of almost old school, right? So because it's all above grade. So we're able to save some money in two different directions, but still achieve our aesthetics, right? So the block we'll pick will be, and that's what, we'll bring in a sample and work with staff or whoever. The block will match color and tone to the brick, right? It's just a bigger unit. And if you were to drive around and just, kind of look, you'd probably see it. It's some use full floor, some might only use 4 or 5 courses of it, but it's a pretty standard to use a large block base with, with brick above, so.
And the stringer course that goes around the whole building
Maintains.
separates it
Exactly.
everywhere, right?
Yeah,
so we're
exactly.
really creating like, a distinct base, brick middle, hardy top.
Yep. So there would be, yes, a precast stone band separating the two.
And then I guess my only question is, why try to match it?
It won't match, it'll be close. But it's not-
Well, yeah. I mean, in the same tones.
Yeah, it's not gonna be like, one's not gonna be gray and the other is gonna be, it'll be it's a buff color.
And it's partially because we're in that historic design district
That's what I was gonna
criteria
ask.
and et cetera. And so to stay true to that, right, we don't want to make it brown or, like Jacob said, a gray, where we want it still to look aesthetically historic, so
So overall, the quality of the building,
doesn't
it
change.
it would not somehow influence the quality of the building at all.
Nope.
And you're not altering the number of units.
Correct. We're just
And-
basically,
And you're reducing the number of bedrooms.
essentially what you're doing is, now the second and the third floor are the same, as opposed to having, one of the issues we have is we have huge one-bedrooms, right? We like 940 to 970
Yeah.
square feet, which are like one-bedroom dens that we have, which is probably at the top end of the size in the market. So, basically, when we have those units on the on the third floor, then the fourth floor loft, those units end up being like 1,400 square feet, essentially. I mean, some of them are like one bedroom plus 2 dens.
Yeah.
So it doesn't.
Right, because if you increase the number of bedrooms or units, you would have to go through the whole rezoning request, which I'm sure you don't want to do. But if you build less than the approval, that's always.
No, the number of units is the
Number
same.
of units is
Yeah, the problem.
No, you're making smaller units.
No, I'm not even making. It's really the problem. Basically the second floor and the third floor are now the same.
Okay.
Versus a unit that was the same on the third floor, then having a fourth floor space. Because just put it in numbers. Say your rent is $1.60 per square foot for a 1-bedroom. Okay, but then when you add the loft, say it drops your rent down to $1.40. Right, but it's
Right.
costing you incrementally more
Yeah.
to build that space than you can get on it, is what we've gone through the exercise of
To
finding.
build that space more into a 2-bedroom unit than a 1-bedroom.
So while you're changing the shape of this, you think that you might be able to save some trees there, or?
No,
or-
the building is not, the footprint isn't changing at all
Okay.
from what we're talking about.
So
And does it affect the stormwater in any case, stormwater issues?
It's
or-
already approved. All we're asking for is changing the exterior material below the first floor from brick to split face.
Doing what's on the
Drawings changing it
Okay.
from what was.
Okay.
So, wait, that's all you're asking for? You're not asking for us to approve the major modification of the building footprint?
Correct, yeah.
Oh.
I'm fine with that. I mean,
This was new information yesterday.
Yeah, okay, I was gonna say
I
that's.
mean, I've been grinding on this number for like a month now, and, we started way over. I've been working with the subs, and like I said, I got a second general contractor bid.
You both need to get Wayman to give you some more money.
I've asked, that request
Lower
went
his
in.
debt
the-
service
The request went in.
cap. Lower his debt service cap and give you more loan.
We made that request this morning as well, too, so.
Okay, so somebody's,
So I would make
yes.
do you wanna comment on
David.
the?
I'm still confused.
Yes.
We're just talking about changing the number of units.
No.
Agreeing to
He's not changing the unit.
Same number of
stays
units.
exactly the same.
exterior finish.
Exactly.
Rusticated base, no loss.
So we just changing the materials
Right.
on
I don't know what
the
it was.
elevations.
Right.
We're not changing,
Big
we're not agreeing yet to changing the footprint.
Correct.
Correct.
Mayor, may I
Yes.
just summarize? In light of the additional information from the applicant, let me go through the bullets just so we're all on the same page. So, street edge, there's no change. David, I thought this, well, it's okay. I just, I'm trying to explain the changes, David. There's no change to the street edge based on his request tonight that's modified to not change the footprint. So the street edge is unchanged, the unit mix is unchanged, The configuration of the third-story units, which is completely internal and not related to the zoning of the project, that is what's changed, and that's not before the Plan Commission. Well, not, not, right. The parking is unchanged. The materials is a change, and because the material at the ground level is a change, it would be my recommendation that you continue to include the condition here with the landscaping, that those two go together.
Okay, so
Materials and the landscaping. So that's what's before you tonight, is the
so the
materials
only
and
thing
landscaping.
which we are approving is the material.
I just want to make clarification. I thought
Okay,
the
yes.
mix was changing, the numbers not, but I thought the mix of bedrooms was changing.
Not with the, because
Not
he-
with this change.
Right, because
Okay,
he
I
was
thought
going,
what he said. Okay.
the original request was
Got
to
it.
go from an L shape to an I shape, and now that he thinks.
I got that.
Okay,
So it's just
And-
the same.
it's
And if
materials
the-
and landscaping.
The issue is if the number of units changes, the number of parking spaces change, but he's not changing the number of bedrooms.
We're actually reducing bedrooms. Because of the, well, technically, we're not reducing bedrooms, but I would imagine there's a high probability that a one-bedroom den with a loft might have two people in it.
But you're not reducing the parking requirement. Sorry.
So what I want to understand, Mark, is
Yep.
why you're including the landscaping, because we're basically going from a smaller unit
Becau-
brick
yeah.
to a block unit, which is larger.
Well-
Including the landscaping because,
It was, this was something actually that was suggested by Jeff Maloney, and I liked the suggestion. I think Abby were you in that meeting too? No, you weren't in that meeting.
I'm trying to save money here, though, like, we're kind of.
So I think the concern was that the material, the change in the materials would make it desirable to have some, change the mix of landscaping along the east foundation wall. Correct me if I'm wrong, Jacob, but you're still requesting the change that you had originally requested. So that's why the landscaping recommendation here is still the same.
just wanted to understand.
Yep. Good question.
Okay, everybody's, Elizabeth, you have something to say?
Have a request to.
A friendly amendment to your motion, you don't have to take it, but I would request that David or staff look carefully at both the landscaping and the blocks. This is the area facing the Conservancy, meaning it is very much the public facing of this building. So if we could take a good look at this, I'd appreciate it.
Thank you, Elizabeth. Okay, so,
Oh,
yes, David.
Sorry. Mark, tell me what you said about landscaping again, please.
Well, I think the materials and the landscaping, change in the materials leads to the recommendation that the landscaping be changed a little bit as well, as I outlined in the staff report, because the two of them, we felt, go together.
That's, but you're talking about the
block.
The around the building.
At the ground level, the below ground level, which is largely exposed on the east side.
I would like to know more about what's happening on the drainage area.
It's not changing.
There's no change
That's-
to the
there's no
rest of it.
change
The
to the
footprint-
approved plan.
Right.
So he changed
No change to
from,
the approved plan.
he has come back to the original, he has gone back to the original plan again, right? So it is, the only thing he's changing from the original is just the material, and that's it. Everything else remained the same. So he just, rather than using the bricks, he's asking to use that 8 by 16.
And that's just below the first
Yes.
floor. It's still brick above that.
I'm totally confused. We're back to the L-shaped building?
Yep.
Yes.
We never, yeah.
Oh, so these drawings that we've got in front of us.
Are useless.
Right.
These aren't the drawings you're looking for.
Okay.
The only thing that does is gives you what the block looks like with the brick.
I thought you were coming back to us to change the building.
That's why, that's why.
He was, but something happened yesterday.
No, he's gonna
that
come back
didn't
for
change it
96
yet.
units, right?
Okay, so is everybody clear now, and is somebody's going to make a motion?
I'll make a motion to approve the change in building materials as a minor SIP modification, subject to the conditions outlined in the staff report and staff approval of the landscape.
Well, the staff recommendation to have some more shrubs at that corner with daylilies to the south.
Yeah, so conditional on the
Yeah.
staff recommendations on landscaping.
Okay, need a second? Okay, any other questions now? Okay, so all those in favor of the motion say aye.
Aye.
Anyone opposed? So the motion passes unanimously. So We are on to item number 7, request for rezoning from Office District B1 to Planned Development District, GIP, the Addison Ostringer Mixed Use Development.
You're not doing any lofts on your one bedrooms, are you?
It's changing from B1 to PDD, so. Aline, anybody wants to say anything? It's essentially, we had approved 38 units, it's 39. That's
So if you
the
turn
only-
to page 15 in the staff report, that is the comprehensive recommendation from staff. If you'd like, I'll quickly summarize it. So we recommend that the Plan Commission approve the revised GIP and rezoning application for 39 units with up to 2,400 square feet of non-retail commercial space, contingent on the following issues resolved to the city's satisfaction. And then there's 7 or 8 bullet points. Do you want me to read through those, or since it's late?
We can reread them.
Well, does,
That was the staff report, not the staff report for this meeting, the previous staff report on that. Yeah.
No, this is the revised staff report.
Revised staff.
Right. You have all the current information in front of you.
well, Eileen, do you want to address some of the issues about build? Because there's some people, many of the people, they were concerned about the density.
Well, the build plan outlines areas and types of redevelopment that could potentially happen along University Avenue. It was a plan that was done 5 years ago or 8 years ago. It was never officially approved, but we did have a lot of public participation in it. We're bringing it back as part of our comp plan updates later this year to officially adopt it. Again, we did have a lot of public input and participation in it. It doesn't specifically say in this area there will be redevelopment. It talks about the University Avenue corridor as being an area for densification, recognizing that there are homes on the other side. So, I don't know, is that?
I would just say the build plan is addressed in pages 9 through 11 of the staff report. And I specifically called out the items that pertain to this site. As Aileen noted, the build plan itself didn't specifically target this site. It talked about it as a corridor. And what we summarized, after reviewing the build plan, planning staff believe that the proposed project is largely compatible with the build plan recommendation, with the exception of the 4-story building height. However, the revisions to the south elevation along University, as depicted in the plan set that you have before you tonight, help ameliorate this concern. And there is no change to the plan that was previously approved by the Plan Commission on March 13th, I think it was, except for that they've done some of the alterations at the street edge, as was shown in their drawing, which I thought was really helpful, showing the before and after changes. The additional unit is absorbed within the original footprint and square footage of the building, previously approved.
One of the conditions is I think as you mentioned earlier, the results of the traffic impact analysis will be incorporated if they're site-specific. They aren't likely to generate any need for instance, a change to the traffic signal at
Right.
University and Park, but it might have something specific on the site.
Second bullet point in my recommendations, successful completion of the traffic impact analysis and requirement to comply with the findings of the analysis, including suitable site access for emergency responders. It's page 15.
Just as a general comment, as kind of a maybe alternative interpretation of future of Middleton is, there's a high demand for people to live here for a high quality of life. We've added thousands of jobs in the years that people have lived here, and if we don't find strategic corridors for high quality infill and redevelopment, which you'd expect along an arterial road like University, then we just have to go out and plow down more cornfields and farm fields to accommodate our growth. So I understand that a lot of people, the concern about changing in the neighborhoods, and growth poses these challenges for everybody, but we can't just wall ourselves off from the jobs and growth happening throughout our county. And, I always tell my students, cities either grow out or they grow up. I mean, you can't just we can't just sprawl north to Wanakee. to accommodate everybody.
And that's a good point, and, or lots of good points. And I just want to make another point. I should have said it, I'm sorry. My mind shut down, I think about an hour ago, sorry. I'm tired, long day.
Amen there.
So I'm not responsible, no, I'm just kidding. We have historically, for the last 50 years, been a community that's about 50-50, multifamily, single-family. There have been some variations, and I was kind of surprised this year. I mean, I've been here 30 years, but I was still a little surprised when I looked at, back in 1980, it was as much as 58% multifamily, 42% single-family, because of a lot of apartments that were built in the 70s. With the apartments that have been approved and are being built in the last couple of years, we are more toward the 53-48, or 53% multifamily, 48%. 47, sorry. And I like numbers and math, I do. But it's cyclical, and it depends on what's happening in the larger scheme of things, the economy, the jobs, and as Commissioner Paulson mentioned, we are a net importer of jobs. Did I say that right, Abby? 8,600 more
We
people.
bring people come in.
Exporter of jobs.
Yeah, exporter of employees, we're an importer of employees. More than 8,000 people come into work every day, than leave to work elsewhere in the city. So we are trying to make sure that people have the opportunity, if they want to live here, and as they work here, there's options for them.
And I would add that, Middleton is not unique. If we look at some of our neighboring communities, they're having the same trend. You see what's happening at Sequoia 10 years ago on Midvale Boulevard. Obviously, Hilldale's a much more dense example. We're not at that point. But this is happening throughout the region.
Yes, David.
Having said that, and having had nice things said about the elevation on the street, I still think it should be 3 stories on the street. I think it's been disguised pretty well, but it's all in one plane. Of movement forwards or backwards, the most. So it's really a 4-story building on the street. Disguised pretty cleverly, but it is a 4-story building on the street. And I think that is too overpowering for the street.
You are going to keep working with them?
No, he tells me that he's tried dozens of examples to show how bad it would look if you made it a 3-story building. 3-story on the street. Probably loses 1 unit.
Well, I would say keep working with them, so I guess, yes, Kurt?
Well, given that we recommended approval to Common Council at 38 units, I'm going to make a motion that we recommend rezoning to Common Council at 39 units, subject to Mark's long list of staff comments.
Okay, so need a second?
A second.
Okay, any other questions? Kathy? Yeah.
Well, I'd just rather see it 3 stories at the street than adding another apartment. I think we're going in the wrong direction that way, so.
Okay. Anyone else?
Was it adding an apartment or that we miscounted wrong? You're not changing the building,
Right.
If you eliminated 1 unit, you wouldn't get it down to 3 stories in the front. Okay, that's what I was.
Why we worked with David to use design techniques to try and make it seem less imposing, at least from his vantage point.
So what happened? Why did it change from 38 to 39?
Took out the community room.
The real quick highlight, so originally, in our original pro forma, we had a club room, a community space in that location. As we kept, as projects do, we keep working the pro forma and we keep looking at the design, and the determination was that club room for a building that small wasn't going to pay the bills. It was better, the appropriate use for that space was better off as a unit. So we simply took and got rid of the club room and put the unit right in its exact place. So the building didn't grow. It was submitted because, as we know, we submit these things weeks in advance of the hearings. During those weeks, we continue to work on it. So that's where the difference was. There was no miscount on your part. That's what was submitted. That was publicly noticed was 38. We continued to look at it and said the best use for that space was an extra unit. That's what we're asking for. Building didn't get any bigger, building didn't change. We just took out an amenity that was inside of it.
I just highlight one quick thing.
Yeah,
I
go
just
ahead.
want to take a chance to highlight one more quick thing, and that was discussed, I think, at the last time. But the recommendation from staff for the rezoning is that the 2,500 square feet of commercial proposed be B1 uses, which is what it's currently zoned. So it's
Non-retail.
There's
Non-retail.
no retail allowed in B1. It's office and I think maybe the only commercial use is a daycare. The other only non-office use. So I just wanted to highlight that, but that hasn't changed.
Okay.
And I would add, Mayor, I look back at my staff comments. The staff report on page 19 provides you with the minutes of the Plan Commission meeting on March 13th, including the public hearing input, as well as the discussion and the motion as recorded in those minutes. And the vote at that time for the same footprint and the same building was a 6-0 vote. And the council has postponed taking final action because they knew about this hearing and that there was going to be this request to infill space within the building to create a 39th unit.
Any other questions? David, you have some questions?
I mean, not to give the reporter something
Yeah.
to quote me on, but I'd be fine seeing, yeah, Cameron, no, you can wake up now, Cameron. I'd be fine seeing University Avenue from the Beltline all the way to campus being 3 to 4 stories with high-capacity BRT right through the middle.
That's
And
rapid transit.
That's,
I think I mentioned in my, Plan Commission meeting, few meetings ago, I would like 3, but, if there is only 1 or 2 story buildings all along the University Avenue, so, 4 is excessive, but I guess, I did mention at that time, and David has mentioned it, so, yeah. Yeah.
We bought those houses knowing that it was a quaint neighborhood.
I don't think I think the public hearing was over, right?
Yeah. Okay, so any other questions or discussion? Otherwise, the motion is to approve 39 units instead of 38. All those in favor say aye.
aye.
Anyone opposed? So the motion passes 3-1.
I'm opposed also.
Oh, okay.
Oh.
Then it's 3-3.
3-3.
3-3? Well, let's have a,
What was that vote, Eileen?
Wait, just a second.
It's
You're 3-3.
3-3.
well.
To recommend to council, so that,
No,
what
it's
happens then?
3-3, so-
So I would make a motion that we send this item to council with no Plan Commission recommendation then, since we can at least ask them to,
Okay,
since it is a GIP, it's a
If
rezoning.
it goes at 3-3, is that the same effect, or
It's the
is it?
same effect as.
Yeah, or to report it to council and ask for action with a 3-3 tied vote.
okay.
Can I
all
make
right.
that motion? I can make that motion.
It has to be an affirmative motion. That's-
So an affirmative motion is to recommend to common council consideration without Plan Commission majority.
Okay, so is there a second? Okay. Okay, all those in favor of this motion say aye.
Aye.
Okay, motion passes, so. Okay, need a motion to adjourn?
Are we done?
Need a second?
I don't want to adjourn.
Who moved it? Did you?
Oh. Okay, we are.